I have to come on Saturday up to Berlin, not Friday.
I don't believe so. Thank you.
All right, can you put me down? Do you want me to email you still, or do you just want me to show up?
You can just show up. I'll let them
All right.
know. I'll actually send them a email right now before I forget.
So it's 8 to
You
8.
said
That's
Saturday?
what I got to do.
You can kind of stay as long as you want.
Can I come earlier?
What's that?
Can I come earlier, like at 7, or will everybody be sleeping?
Usually like shift changes at who's on? Yeah, it's Bill. So
Saturday.
like our shift changes at 7, so there's usually some commotion, and I'll be there in the morning anyways. If you come earlier,
Yeah.
I'll be there anyways. So yeah, that should be fine.
Yeah, I might come at 7 just because I can leave at 7. I get home around 9:15. I mean at 8:15. That'd be better than 9. So
Yeah.
cool. All right, thank you.
Oh, this will be good. Who else is on? Oh, I'll do it in a second. Hang on.
I get an email all my titers and stuff to
Kevin.
Kevin anyways. Yeah, I haven't done that yet. My HPSO or whatever that thing's called. Got it.
Right.
I just
Is I forgot the kid. Fred's son's. What's his name? I forgot already.
play. Colin. Colin.
Colin. Is he
Colin.
coming
Last
on,
name's
or
Clay.
Tina?
Tina said she'd be here.
Oh, okay.
Here, Kevin, Morgan, Kim. Oh,
I don't know who's here.
Okay. Is Kevin on, or
I see him. Yeah, he's on mute.
oh, you? Oh, never mind then. Sweet. So, like, I was hoping to just go over your exam. I don't know if Kevin has an issue with it or not. This from the other day. I don't know if he's graded it. So I was kind of hoping that maybe I'll call him real, or unless he's
I don't
on.
know if everyone's taken it.
Yeah, I think because it's not. I think it closes on Thursday night.
Oh, then
Thursday.
then we won't do that then. Okay, yeah, that is. I thought it was like only a 1 day thing.
No, he gave us a week, right, Jen?
Yeah, he extended it. He did it. He gave us the full week to do it. We still only have 3
Oh,
hours
he
once
did.
we start. But it was,
I took all of it.
as did I.
Oh, never mind. Then we're not gonna go over exam. What about last week's? Oh, that's not. I can't even touch it. All right, never mind. We're not gonna do that. Just kind of more or less wanted to like talk about how I do tests, because you got like listening from what you guys were talking about on how do you guys create the test prep?
Oh, and JB Learning.
Yeah, I'll share my screen with you. So
Yep. So you just go to create. Yep. That's it.
We already have an exam again next Tuesday. Holy shit!
I'll just do 20. So like I started taking it the other day, last night actually, their exam for 2. There's just I guess a way. I don't know if Kevin has a way of doing it or wants me to teach it, but so like especially with National Registry, they like you're never gonna get 100. So like don't even try. just do the best you can. I know for the perfectionist, it's hard to hear and swallow. So, like this one, it says firefighters have reached a man from the burning house. He is conscious and alert, but expecting significant respiratory distress. He has brassy cough and singed nasal hair. The most immediate threat to this patient's life is,
Swelling airway. No.
right. Yeah, it is.
Okay.
So, like, I don't know. Anytime there's like a question about airway or breathing, or especially the first thing that you're supposed to do, that would probably be your go-to. Like, they're all pretty good answers, but like with the singed hair and the brassy
Yeah.
cough, that's a indication of like smoke inhalation.
That's hard to treat or hard to see inside of the body.
Like, which of the following most significant find a patient experiencing an allergic reaction?
To the phone.
So they're kind of like asking you. It's more of a patient. Like you kind of have to break it down or reword it in your own way. Is like, okay, what they're asking you, can you recognize what a severe allergic reaction is? So hoarseness, like that could be like airway swelling. I wouldn't consider headache. Like a widespread rash is definitely an indication of abdominal cramps. It wouldn't be one either. So they're not even talking about anaphylaxis. They're just talking about a rash, right?
Mhm.
So like this A or D are like really good answers, and I would probably go with D
Most significant
or A.
finding.
Probably A because it's airway swelling. Right?
When you pick it, does it tell you it's red or green?
I don't know. I don't know the answer to that.
Tell you right
But
off
like,
if you got it right.
you are. It'd be nice. After delivering one shock with AED and performing 2 minutes of CPR, woman with cardiac arrest, we realized her cardiac rhythm. We have no shock advised. This means she's not a shockable rhythm. There's pulse, has electrical activity but no pulse. Her rhythm is deteriorated to asystole. The first shock restored her rhythm and pulse. So like the three of these, or four of these actually, all of them are good answers.
So
But like the best answer would be A.
Yeah.
Like overall, it's just a non-shockable rhythm. But they're all like the questions that he had on the exam, like I don't know, they were better. Like for examples, we'll do it next Tuesday after the quiz, the exam close. Hopefully, I can get them and show them. But basically, you just don't want to read into the question, like kind of like think to yourself, what are they asking? And they put a lot of fluff, especially the exam questions that he had on. There was a lot of fluff in what I saw, and like to deter you from what they're really asking. Like especially the patient assessment ones. So you're assessing a middle-aged man with experiencing respiratory distress. Patient has a history of emphysema and hypertension. He appears fatigued, weak retractions, and has labored shallow breathing. You should A. Administer oxygen with non-rebreathing mask. Also take breath sounds to detect wheezing. Ventilate him with a bag mask device. Assess his oxygenation saturation with pulse oximeter.
I think this one was on.
Um,
I think this was on the exam.
I think it was on
I
the
think so
exam too.
too.
Yeah, I think it was.
So like these are really like any four of these questions would be correct. Minus I wouldn't do B because like wheezing's more for asthma, and that's not gonna be my first thing to do. Anytime there's gonna be oxygen, like apply an oxygen of any sort or manage the airway, that's going to be your answer. Like you can assess his oscillation with a pulse oximeter just to get a baseline. It's going to take a second. I'm not a fan of pulse ox, like my first thing to do, but so your answer should usually be
A.
not administer oxygen with. So which of the assessment findings would you expect to encounter in a newborn infant? Sure, like cyanosis of the hands and feet, because that means like I don't know if we went over this. I didn't remember going over this with you. Their heart rate better not be below 100, so that's not good. Delayed apnea for 2 minutes, that's not good. Shallow irregular gasping breaths, that's not good. So sinus, so see, they're kind of like tricking you. Like these are all pretty bad. But like if you ever see newborn kids, they're always like cyanosis with their hands and feet because they're kind of switching over from like their mother circulatory system to the like their own, and it takes a few minutes. So following administration of nitroglycerin, man with crushing chest pressure, he experienced a significant increase of his heart rate, the most likely result of cardiac dysrhythmia, pre-existing hypertension, a drop in blood pressure, coronary vasoconstriction. So it's kind of asking you, like, do you know what the side effects of nitroglycerin are? This is what this, like, just reworded differently. So nitroglycerin doesn't really cause dysrhythmia. It doesn't. He doesn't have pre-existing hypertension. So it's going to be like a C. Like the side effect is drop in blood pressure, and it causes coronary vasodilation, not constriction. So you kind of have to like not read, like find out what they're kind of asking you overall, not like. Does that make sense?
Yeah.
It's just like, and I know you, Jen, said that you were kind of like overreading into it and like looking in your book.
Well,
Which
because
patient of following?
well, I was just
Go
gonna
ahead.
say is that like what I get hung up on is you. I'm like, well, that answer's right, and that answer's right. It's like that. It's almost like they give you more than one right answer. So I end up
Right.
like overthinking them because it's like I feel like they're intentionally tricking me. So I almost feel like I'm missing
They are.
something.
Wait until you get to the National Registry.
Great.
It's like a huge it's a psychological. It's a game. They're playing a game. It's like when they want you to be good clinicians, and it's not always black and white. So like this one's, it's which of the following patients obviously needs CPAP or positive pressure ventilation. So really, they're saying, can you identify the require or the identify the need for CPAP or BVM? Are you going to do a comparative patient with respiration? No.
No.
Semi-conscious? No, because they need to be conscious and be able to
Yeah.
restless, but he has an adequate tidal volume. So like these are all kind of crappy answers.
So you'd pick D.
Responsive to pain only.
Oh no, that means that they're unconscious too.
No, yeah, because
Yeah,
they're not responsive.
They're not responsive. That's right.
So
Semi-conscious.
maybe A, because it's one of the side because
Because
he
they
is a
have
little
like
significant and he's breathing deep, so like he's labored-ish, and maybe like it's one of the early signs of hypoxia is being combative or altered mental status, because they become really agitated. So this is kind of a tricky question. I don't know if they like have. I wish they would show like the when triaging patients with this. Oh, we didn't cover mass casualties yet, have we?
no.
I'll just answer it then. So they're kind of trying to, again, put some fluff at you. They're seeing if you know what you can determine, like if it's green, yellow, red, or black. But they're making it like they're gonna pull at your emotions and say it's a 3-year-old boy, but he's unresponsive and not breathing. So you're just gonna open his airway, move on. There's nothing else you can really do for him. And so you assign him as black. You receive a call for a 4-month-old infant who suddenly became limp, cyanotic, and apneic. Upon EMS arrival, tells you he's flicked the feet. He woke up. He's breathing adequately. He's good muscle tone. Oh, did we go over bruise?
I don't think so.
Not bruise. Brief, unexplained. I can't remember what it's called. So his good muscle tone, skin's warm pink. So this is probably one of those rare things. Like, would you oxygen via non-rebreather mask? The baby's not going to let you. Allow a parent to transport him to the hospital. That's up to your conscience. I probably would. Maybe. No, I would not. But I would transport. See, here's another test thing. These are two very opposite answers. So it's probably going to be one of those two. And the better of the two would be transport to the hospital and monitor him en route. Right?
Yeah.
Which of the following signs and symptoms of a patient with severe anemia? Beats me. So they're just asking this question's like, can you tell the difference between what the skin color, condition, temperature means? So flushed skin with low pulse is usually like hyperthermic patients. Jaundice with abdominal pain is hepatitis or sarcosis.
I would say that.
Hemitaxis. I would pallor with shortness of breath, because severe anemia is like when there's not a lot of hemoglobin or hematocrit on the red cells, or they have a low red blood cell count. So that's what the question's asking. Do you know what is the differences between this and this is what we're looking for? So anemia, do you know what that means?
Low red blood cell count.
Yep. I'm not sure what hematemesis. I think vomit in the blood. I'd have to look.
Yeah, I think that is. I've looked that
It's-
word up many times.
So a 33-year-old man struck a parked car with his motorcycle, thrown from the motorcycle. He was not wearing a helmet. He's unresponsive, has a depressed area to his forehead. Not a good sign. Bilateral deformed femurs, abrasions, and capillary bleeding. You should expect he has a skull fracture. That's probably a good indication.
Is false.
Oh, yeah. See, that's a good pickup. I would have probably picked the wrong answer because I didn't read the question all the way.
It's false.
Yeah. So I do suspect he has a skull fracture.
Femurs or common injury. Internal hemorrhaging cannot be controlled in the field.
That's true.
So I would say it's got to be D.
It is D.
Yeah.
I mean,
Yeah, you don't want to really worry about abrasions
Yeah, we're probably not going to be bleeding that much.
when he's got broken femurs.
the skull fracture.
Right. So process of removing and neutralizing appropriate hazardous material from any decontamination.
Yeah, D.
Man, that was an
Sorry.
easy question. Why couldn't I gotten that one?
I
Right?
don't know.
That's
So
easy.
yeah, I don't know. Yeah, that's basically what that's just the definition. They're looking for a definition. Which of the following signs at least suggestive of a diabetic emergency? Oh, So they're asking you, like, do you know the signs and
Yes.
symptoms of
Yeah.
hypo or hyperglycemia? This is
I
can
I think
patients
it's
have
G.
I
what's
would
that?
say
C.
See,
Combatants.
Oh, I'm gonna disagree.
wait, tachycardia is high, bradycardia is low.
but it says which of the following signs is the least suggestive? Just because they're
Ah,
combative,
please.
doesn't mean they're diabetic.
That's true. Yeah, maybe.
I mean, I don't know. I could be completely wrong. See, this is where I read into it. I'm like, well,
Right.
lots of
So
people are
they're asking
combative.
you. They're asking you overall. Do you know the signs and symptoms of a diabetic patient? Can they have fruity breath?
Yes.
Yes, especially when they're hyperglycemic. Can they become combative if they become hypo and they're just not there yet
Yes,
to
they
be
can.
and then like definitely if they're like hyper, can they become tachycardic? And usually here again, you get two very different possible answers. So it's probably gonna be one of these two.
So it's probably A then.
It's probably A.
So that's your thought process in questions is if there's two completely opposite, that could be one of them. And
I
that's what
narrow
they
it
do.
down
They
that
play
way.
games.
Oh yeah, they play games. I narrow it down that way.
So the
Patients
hypoxic
with
drive.
I saw this one last night, not to give any hints.
Patients with a hypoxic drive.
So which patients are the ones that with hypoxic drive? Does anybody remember?
Like your COPDers?
Yep, there's COPDers. What do normal patients breathe on? What's that called?
What's it called?
Yeah, there's a name for it. I can't remember right off the top of my head. So now you're gonna have to make me look it up.
I don't know.
Chemoreceptors. I don't know. There is a name for it. I'll have to look it up. But it's the chemoreceptors in the base of the brain. That is what does it. I know it came up. But yes, so it's a hypoxic drive. It's right there. COPDs. And where did that go? And they live off of lower oxygen levels and higher carbon dioxide levels. Right?
Yes.
Rarely becomes cyanotic because of high blood oxygen. No, it causes the low levels of. No, this is a weird
Wait,
question.
no, it's not hypoventilate. They hyperventilate. No, wait a minute.
No, I think. Well, if you give them like oxygen, they're supposed to slow down because it increases the CO2 level in theory, or decreases the CO2 level. I think in theory.
I don't think that's the answer.
Which one do you think it is? You're probably right.
I think it's B.
Okay, we'll go with B. I like that.
Stimulated to breathe by low.
Did I mess you up?
No, go ahead.
I think she's right. Actually, the
Muscular
active
part of
muscular parts of
breathing.
breathing is called.
The muscular part.
So these are all like parts of the respiratory system.
Right. I don't know
But
the
they're
muscular part.
so they're kind of like tricking you. They're like the more mechanical part of it.
I would say the inhalation part.
Ventilation, yes. This one or this one?
The active muscular part of breathing.
Oh, that's a good. That's a tricky. They trick.
It's an inhalation. That's the part that uses your muscles.
Right. Because remember when we talked
See,
about it.
I know all this shit when we're sitting here. Why can't I know the answers when I take the test?
Because they word it differently. You have confidence in yourself. The dispatch to a call for an unresponsive patient is the following most important information that you should initially obtain from the dispatcher. Is the scene of safe? exact location of the patient. That'd be nice sometimes. None of these.
No.
I mean, which are the most important information that you should initially obtain from the dispatcher? I mean, you have to know how to get there.
Yep.
So the exact location is pretty good.
You
Callback
definitely don't
number.
need the callback
You don't
number.
call back. No.
No, I don't
Patient
care about
sex, and appropriate age is not really a big deal.
I would say D.
I know.
Are they
Whether
Yeah, I
the
breathing?
like
patient is
D.
breathing.
I mean,
Yeah,
are
I
they
like
D?
D.
Yeah.
I kind of like to
What?
know
Airway
D
breathing.
because, like, even if I don't know anything else, if it's a younger patient, I'm going to think it's going to be a traumatic injury, and
Oh,
Yeah.
that makes
males are
sense.
more
too.
prone. Like anything over the age of 40, that could be me. If breathing or not breathing, that's probably important too. So yeah, those are two very good. We'll go with D.
Pick it up. We got pick it. I mean,
How many more do we have?
3 more, then we can see how many we get. 16.
Extended man reports dyspnea began 2 days ago. Has gotten worse. Which is the following assessment? Which you most information regarding possible cause?
I'll go
Uh,
pause. This is a crappy question too.
Following assessment would give you the most information.
Probably lung sounds for me.
Yeah, that's what I was thinking too.
Because he's probably gonna be altered if he is hypoxic. I'm gonna know if his oxygen saturation by walking in the room. Pulse and rate and quality would be important too, but like the lung sounds would tell me like if it's
What
like
it would be.
rhonchi, wheezing,
High
clear,
look, yeah.
stride, coarse,
So it-
could it be pneumonia?
All right, let's pick it. A.
Oh, this is more of operation things. I can just give you the answer on that.
What are the recommended dimensions for a helicopter landing zone? I don't
Yep.
remember reading that.
You don't. We
Not there
haven't.
yet.
I'm just picking it.
Okay,
Just trust me.
so it's 100 feet.
Yep. You see where man history coronary arteries began experiencing chest pain nodule on his daily jog. Oh no.
They're sitting down rest for 5 minutes pain as a result. Which of the following best describes?
Angina.
He has angina.
What makes you say he has angina?
Because it
'Cause
went away, exertion,
not
and it went
resting.
away within 5 minutes.
At rest. But is it stable or unstable?
What's the difference?
I think it got better within 5 minutes. So,
What is that? That's the answer.
Well, what's unstable? Then what would make it unstable?
When it doesn't go away.
That's a
Well-
Or it goes away and
Damn.
comes back.
Well, if he
Oh,
gets
right.
back up, it could come back, which would make it unstable.
Yep.
See, that's where I'm reading into it too much.
Pretty much.
I'd have picked D probably.
This sucks.
Did we didn't go over we did go over bleeding, right?
We
Yeah,
did.
we did go over bleeding. Yep.
It has large lacerations in his right calf after the chainsaw he was using slipped. The wound
Dark
extends
blood is not arterial.
Right.
It's flowing heavily from the wound. The
It's
EMT
vein.
should apply direct pressure. D.
Applied tourniquet. Position the position to elevate his leg.
I think the dark red blood flowing heavily.
Yeah, they're asking you how to treat
I would probably try D.
I would D. Just apply pressure with a sterile dressing. Because they didn't say it was spurting. Congratulations.
Oh, we got an 80.
Woohoo, we passed.
We got an 80 with 3 of us and a paramedic.
Oh, don't.
Hey, it's passing.
How do we tell if we're like what ones we got wrong or
You have
right?
to go back to
I think it's a review.
Review.
What?
Down at the bottom. And then
Oh, I got a 67 up stretch.
somewhere you can review it. I think you have to go back to it.
Uh-oh.
That's all right. Click in there. And go to the practice ones you did.
Nope.
No, the
Do you
one under you,
review practice tests?
above
This
that.
one.
Right
There you go.
Yeah, let's try that one.
And
Practice
then-
test assessments, view past results.
Oh,
Oh, I
doesn't-
don't think. What happens if we? Not that I
no, you can review it.
can you.
You can, because I reviewed mine. Let me go in to see how I did it.
Oh God.
Are you getting there?
No, I think this one. Like this one will show the.
Hold on. Test prep.
I don't know.
Hold on. You getting there?
Is tutorial mode or test?
Okay, so what you have to do is, oh, you're gonna redo another one. So go into where you
Yeah.
click, review it. Then go down to where it has the date and the time where we took the test. Nope, click that. It's gonna open it, and then the ones that you got wrong, you click it, and it will take you to the question, and then you can review it. All right. Well, we knew we needed to give him oxygen. We just didn't choose the right
Right.
equipment.
So yeah, it makes sense. He appears fatigued. I can't highlight it right now. So
Yeah.
they're tired and he's not gonna be breathing for himself much longer. So that
Yeah.
makes sense. Oh, how do we?
Yep. There you go. One patient needs positive.
So maybe this was with a BVM, and I was reading into the question myself, and not because it's 8 minutes, and you can, right? Because he's too slow, so you want to speed him up and then get a good ventilation into him, is what they're saying. I was reading into it differently.
Even though he's responsive to pain only.
Well, you were using a BVM. We're not going to be CPAPing him
Oh.
because BVM is positive pressure as well. It's not continuous.
Aha.
Oh, that's a trick.
Yeah. See, we didn't read the question right.
Right. Yeah.
No, I get it. I hear you. 100%.
So don't listen to me. This is why I gotta stop doing it. How do we just go?
Here you go. And just choose the next one.
Oh, it says for palpable pulse, and then we do just these, but we didn't go much into. We haven't done MCIs yet, so we don't really care. So yeah, so this is the anemia part 1.
Yep.
So yeah, this brief unexplained. It's kind of like the where you put the kid down and they die in their sleep. What is that called?
SIDS.
SIDS. It's kind of like SIDS, but a new term for it, which is more politically correct. So that's what that is, and they should be transported. And if the patient, like, you can't really fight the mother or parent about it, but as long as the patient gets to the hospital or the kid, whatever. But it's best if you take them, because you can monitor and do stuff and let the hospital know.
Is it called
Contamination.
sudden unexpected death in infancy? SUDI?
Yeah.
SUDI.
SUDI?
SUDI.
SUDI?
So yeah, now it's changed again since last time I knew about it. So yeah, the
SIDS and
bradycardia.
SUD are SIDS and that's not the same. The SUD.
So the
That was just a Google thing. It might not be it.
diabetic emergency was because the heart's going to try to compensate, like, because it doesn't know what's going on, so it's just going to speed up until it doesn't. So you were right about that one, Jen. The hypoxic drive.
Yay! Got one right.
There's
And
another one
annihilates
called
the heart.
SUDC. There's another one. There's 3 different ones. I don't know which one is the new name.
See, this is yes.
Oh, so I was wrong. You followed my suit, and I was wrong.
And I would have probably picked A. I kind of was like, well, you kind of have to know where they are, I would think, but then
Well, usually
that sounds like
yeah,
a stupid answer, though.
yeah. That's probably on chapter 1, but it is good to know where they are. So yeah, the dyspnea, because that's where you're going to get your most information from. I think that's an assessment question. Yeah, this is more of the operations. We'll learn about that.
Yep.
But there's your answer if he ever comes up with another question. And it will come up. And that's stable angina. Does it say stable?
Angina is classified as being stable, unstable. Stable angina is characterized by cardiac-related chest pain that resolves with rest. Unstable is also referred to as pre-infarction angina because it indicates a more severe degree of lead to an acute myocardial infarction.
Right.
Mm,
And what's the number one lesson we learned about people with chest pain? Should they drive or not drive?
not
No,
drive.
right. And I won't do it again.
So yeah, and what you're right. They were talking about like if you knew how to treat a venous wound, and they're still dramatic. Like venous wounds are chainsaw wounds are gnarly. So yeah,
The thing that got me was down to the muscle and dark blood flowing.
yeah.
It wasn't cut the whole leg off.
Right. It
Arterial,
didn't say,
bright
and
red
it didn't
blood.
say it was spurting. Spurting's
Yeah.
the other indicator usually.
And bright red. Bright red
Yeah.
is important too. Yeah.
I don't. Moving on. So do you want to do some more, like a few more test questions, or you want to move on to?
We're gonna do 18 and 33, right?
Yeah.
Yeah.
And I think 33 is
Whatever.
really short.
Yeah, it is. It's easy too. I can't wait to get these exams.
We'll just do a few more, so we can just make it an hour, and then we can.
Okay.
Does that sound okay to you, or you guys want to do?
No, fine.
I have nothing to do but sleep
That's
Right.
cool.
while you're preparing this new test. So last night at 6 o'clock.
So is it
What?
or assessment
I'm sorry.
test?
We're gonna
Practice
do
or
another one?
assessment? Yeah, we'll just do it.
Um,
To make it an hour. It's like 5 or 6. We'll do, I guess. What's the difference between tutorial mode or test mode?
I don't know. I think
Do
I always
test
just do test mode.
Oh. Matter. While transporting a patient non-emergency mode, the ambulance operator notices another motorist following too close behind. The ambulance operator should give him a tap the brakes.
brake
Right,
check.
maybe. So the speed of the ambulance encourage motor to pass, increase the speed of the ambulance.
This is a critical. I think this is a operations question too.
I would probably pick the safest one. I think is you definitely want to tap the brakes.
Huh.
I would pick B. That's the one
I
I would
think I
pick.
would say B too,
Yeah, B.
Okay.
even though I'd
I
like
B,
to tap the brakes, but
You don't go faster because they'll probably just follow you.
probably.
I don't think they'd pass. I
Patient.
think it'd be tough for them to pass you.
So they're asking, like, look out for the negative. They're asking you, like, what, and this was on the overdose
That's
toxicology.
That's a fast one, like cocaine, right?
Yeah, it's a.
Yep.
So
So
they're gonna be
A,
agitated.
B,
Oh yeah.
A, B, and C. I would think dilated pupils are big. Pinpointed.
Right.
Pinpointed's heroin,
I
right?
can tell all of the following.
No. So like, they definitely become agitated.
Definitely.
They don't have great. They're. It's in a upper. What is it? I can't think of the word. I'm so. But usually with these kind of meds, their pupils like they get like they're blown. They're huge, and they get hypertensive. So like
Dilated. Yep.
it's. But that's what they're asking you. What's the signs and symptoms of somebody that's on meth? And it's not B, because they're going to be tacky. And I was talking about this with somebody the
Oh,
other day.
Brady. Oh my God.
Yeah. Somebody who like we've had it in Berlin a lot. They will take heroin and methamphetamine at the same time,
Jesus.
and so they like pass out, and then like the cops will come along and give them Narcan, or they pass out, or they're semi like when you wake them up, they're like all over the place until they fall back to sleep randomly, but their pulse is like skyrocketing. And I can't remember what the name of the concoction is called, but yeah.
So
It's pretty
heroin's the one that dilates.
No,
No,
heroin's
the one that pinpoints, right?
constricts. Yep.
Constricts, yeah. All right.
It's a depressant, and cocaine and meth are not depressants. I can't think of the word. They're semi-cholinergic. After completing a rapid assessment of patient penetrating chest trauma injury, the EMT tells his partner they suspect a pericardial tamponade, which of the following did the EMT most likely encounter during her assessment? I don't think we went into this a lot. I know we talked about it.
Blood around the muscle, right?
Yeah.
So I would think it'd do something to the heart, slow bounding.
Widening pulse pressure, slow bounding pulse. I would say either A or C.
You remember Beck's triad? Okay. And also
Briefly.
you can also look for clues into the question. So pericardial tamponade, do you know what that is?
Yes, blood
It's stuck around the heart, right?
Right. So it's going to be something with the heart.
Yep.
So it's probably not going to be the C.
It's B.
Um,
Yeah.
Somebody said B. Yeah, it is.
Yeah, because I went and looked at Beck's triad, and that's one of them.
And that's what?
So
Distended jugular?
Most likely, yeah.
yeah, it's
That's
going
what
to
I
have.
think.
It is. They're going to have a quicker pulse because the heart has to compensate. But it's going to be blacking up, so that's where the veins get distended. And it's not winding pulse pressure. It's going to be shorter pulse pressure. It's going to get closer together. So it's B.
Gotcha.
Man was struck at the side of the head of a steel pipe. That looks fun. Blood tinged fluid is draining from his ear. Oh, Zach talked about this.
Spinal fluid.
I wouldn't do A.
Right. So they're asking you how you would.
I wouldn't pack the
Pretty
ear.
straightforward. Right.
No, I would not pack
But-
the ear. Control the
I would
drainage
do
from the
that
ear.
one.
Mobilize the entire spine. Immobilize the spine. Administer
Yeah,
oxygen.
ear.
I would say D.
I would too.
D.
Yep.
Because controlling the drainage from the ear, to me, does that mean that they are insisting that we may like put a gauze up against it or something? You know, I don't. Yeah, so I'd pick D.
It is, I don't. Where does this? I know they said it was what B. Yeah, we don't ever pack anything to any wound, except for one instance, and that is OB
Overdose.
and some bleeding. No, OB, obstructions, babies.
Oh,
Yeah.
So if a baby has blood coming from
No.
their ears,
No, the mother. No.
There's a specific. We'll get to that in OB.
the mom has blood coming out her ears.
No, it's
Oh my God, Jason!
What am I talking about?
Do you know where your children came from?
Oh, down there. I thought we were talking about ears. I get it. All right, I know now. Right, I get it now. Now I'm embarrassed.
Wow, that was
All right,
awesome.
That was literally the best part of my day.
Oh my God.
Morgan didn't know how to explain it. He's like, really, Jeff?
It's prolapse cord.
Like,
All
we
right.
will just discuss it later.
All right.
I mean, what question are we on? So yeah,
Oh,
72-year-old woman reports dyspnea. Woke up from her sleep. Her feet and ankles are swollen. So, and I know we talked about this a lot. Auscultation, low lungs, reveal crackles. History is hypertension, type 2 diabetes, heart attack, blah blah blah. Her BP is 170/94. Her pulse is 110. So they're asking you, like, they're giving you the signs and symptoms, and they're asking you, what do you think their diagnosis is? What do you think is going on?
B.
B.
Congestive heart
Yeah.
failure.
Yeah.
It's got pulmonary edema. Congestive heart failure for sure.
So medications such as albuterol, and I know we went over this, it's constricting the bronchioles in the lungs, contracting the smaller airways in the lungs. No, we don't definitely want to do that. We want to open it all up. Relaxing smooth muscles in the bronchioles, dilating the large main stem bronchi of the airway.
D. Dilating them.
Yes, it dilates
Opening
them.
them up.
Which of the following is considered severe burn to a pediatric patient? Oh, we didn't cover burns yet. Where is it considered severe patient? Partial thickness burn, any full thickness regard? No, that's not true. Any partial thickness burn involves the lower extremities. So yeah, I'm gonna go with this one. I think. Okay. So we'll get the rules of 9 under burns. Full, yeah. I don't have time. Which of the following complications is renal failure? Uremia, cystitis, I think. Renal calci, low potassium.
Complicated renal failure.
I don't think we went over this either. I don't know the answer.
I think we did. It was in.
I think it's low potassium because they pee it all out.
I think Jim's right.
Okay, but they don't, like, usually with renal failure they have issues with peeing. So you're probably right.
Well, that's
but
not.
When they
it
off, they do have issues with electrolytes. So I'm gonna go with that.
Okay.
We went over this kind of, but this is more materials.
Arriving at a chemical fire plant is a commander should experience the plant representative of the plan of.
Yeah.
Oh yeah, we did. We went over that.
Yep.
Oh, did we?
Yep.
We did. We went over that.
9-month-old infant presents with cough, runny nose, and respiratory distress. A whoop sound is heard during inhalation. What would you expect? We did cover this.
It's
B.
either
Pertussis. Pertussis.
Okay. Yep.
I think so. I could
Yeah.
be wrong. I'm just.
I was going with poop, but you're probably right with pertussis. So yeah, it's definitely be A or B. C is lower. D is definitely lower, and you're not gonna hear it audibly. So yeah, it's probably because whooping cough. You ready?
Yeah.
Oh, how did we do on that one? Oh, we did worse.
Worse.
70. All right,
Great.
Oh well, we also did only 10 questions. Did we? Oh, this is the old
Oh,
one.
I think you chose the wrong one.
There's a
You
shot.
gotta go back to the other one. Yeah, there you go. That's the one you want. First one.
Never mind.
There you go.
Oh, we only got 3.
Well, 10 questions, yeah.
So yeah, relaxing the smooth muscles of the bronchioles.
So it doesn't dilate?
It does. It's kind of a tricky answer question because I would have gone with that, but I guess it does the bronchial where it all starts branches off. That's when it opens up, not the bigger ones.
Oh.
So they're kind of messing with you with the words.
Sorry.
I was right.
Oh, you were right.
I thought it was any because of
Wow.
the baby. I thought the baby part skipped it.
Oh,
And if you look at it, like my answer and the wrong answer were the same exact, except one was 15, one was all.
Yeah.
Oh no, partial and full thickness too. Yeah. To the full.
Oh.
Jen.
I'm sorry.
That's okay.
Dumpy.
I could have sworn it was low potassium.
After you
When
said
kidneys
that,
fail,
he said that they don't pee it out. Then I was like, well, it can't be D. But I honestly didn't know the right answer, so I didn't answer.
I didn't know either. I know just there's a lot of issues. Renal failure.
You've gotten into the hospital breathing.
Yep.
That would have been a good deal.
All right. So let's take 5.
All right. I'll be right back.
Any questions about taking questions? Just like doing tests.
I need to do more of them.
Yeah.
I guess just get the hand of them. I know it's like one of the. All right. And then we're gonna do a case study when you get back.
Okay.
Let me get my
Don't really
notes.
go anywhere. It's okay.
I 100% thought we were talking about ears. I think you guys were going in and out, and all I heard was ears. And I'm like, what?
He said
they're
OB.
pregnant? You don't.
As soon as he said
fucking
OB,
ears?
I thought for sure you knew what we were talking about.
No. Well, after I kind of understood it.
That was amazing. Absolutely amazing.
My wife, I'd never lived this down. So, my wife was sick remember I told you that my son was born 8 weeks early.
Yes.
So we were at our first house,
What are
and
you reading?
we were both super young, and she come home early that day because she had a wicked headache and she just didn't feel good. So she went in, laid down, and it's like 2 o'clock in the afternoon, and I'm in the boys' room, I'm in the baby's
Like
room
her-
painting, right? And I have the door shut. All of a sudden she comes to the door and she knocks and she's crying. She's like, my water just broke. I'm like, no, it didn't. Like, what the heck, right? She's like, yeah, it did. I'm like, no, it didn't. And I said,
Oh,
go,
God,
go
America.
in. So, so I went paint. I kept painting. Like I
Oh.
seriously thought she was just, wrong
God, you're a
about
wife.
it. We went to the hospital shortly.
Yeah.
Then we get to the hospital and the nurse told us, she's like, oh, they'll probably send you home. I'm like, I ain't a freaking doctor, but I know if there ain't no more fluid in there, they're not gonna send us home, woman. Like, are you kidding me? I can't even believe she told us that. I was like, what in the world are you thinking?
Oh my God, too funny.
That was a tough night.
Well, especially because he was healthy, he was preemie.
Very tiny. And there were so many people in the room. Oh my God, it was crazy. And then as soon as he came out, he was gone. And Anna was like, is he breathing? And I'm like, I think he was.
Yeah, sorry.
Scary anyway.
Yeah, it was. Are we being recorded right now?
I think so.
I thought they
I
stopped.
think he stopped it.
Who cares? What about it?
Hopefully you get better, Jen.
Oh my God. You have no idea. I'm so over this sickness.
Tina's not on tonight.
She
Is
was
she?
working today. She was on an
Okay.
ambulance run
Oh,
earlier.
okay.
So I'm wondering if maybe she had another opportunity and she took it. I don't
You'll
know.
watch the video
That would
after.
be my guess.
Yeah.
But if I don't get better soon, I don't know what I'm gonna do. I've literally been sick since the end of August.
Because you take breaks when you're in class.
My doctor keeps telling me it's viral, but I don't know.
Ever since, like I told you, ever since I had COVID last year, I feel like I've just, when I get sick, I just stay sick longer. And
Well, that's like this. Stupid.
weird.
It's just stupid.
No, get down.
I mean, like stupid sick. I'm just over it.
Tim, I was face stalking you the other day, and you like cats as much as I do.
I love my cats.
I love
I
cats
love
too.
my
We're
cat.
we're down to one right now from 4, and I'm
God, I love my boys.
gotta get some more. Yeah. I want a big Maine Coon, so I gotta save up though. I want to get a yellow or a gold Maine Coon.
Maine Coons are great, but they're not like super cuddly.
You
They're
know,
I mean, they can be,
yeah.
but like my parents have had 2, and I will tell you, both of them are like, don't
Really?
touch me.
The last one.
If you want a super cuddly cat, the best one I can recommend is a Spanx.
Right?
Oh, really?
The hairless,
Is that the
yeah.
hairless one?
Yeah, so my bosses have 4 of them. And I'm like their adopted daughter
Yeah.
/ pet sitter. So they're like
Oh, the hairless cat's not
they're
yours.
like my own. So I
There's
love them right to
see it.
death. And they are the most cuddling, like lovable
Nice.
animals.
Well, because they're probably always cold. They want you
No.
That's true.
they want you
So-
to hold.
She had, when I went there today, she had the heat on, and all of the cats were under heated blankets with the heat on.
That's so funny.
I'm like, it is hot in here. I'm dying. Oh my God.
My cats are Siamese, and they are super lovable.
I think I'm muted.
I mean, my
Nope, I'm
cats
not.
are random
I don't know how to.
Yeah. Just
cats.
everyday cats. Yep.
One was found as a little baby tiny kitten, about 2 weeks old, if that. In that first major rainstorm that we got,
Oh, yep.
my sister-in-law heard something meowing out the window, and there was 5 kittens. Someone just dropped them off.
It sucks. I hate people.
So I took her super early, because they had a male cat that just didn't want the kittens around. So I took her at 3.5 weeks. And then Dexter, my older one, I've had him since he was 8 weeks old, and he's the love of my life.
Yeah, my cats are like my children. They're like crazy.
Yeah.
I spend big bucks when I go on vacation to pay someone to stay with my cats. Not to feed them, to literally stay here.
Yeah.
People think I'm crazy.
When I went on my honeymoon, I had my brother stay just overnight because I wouldn't leave my pets very
Yeah,
long.
That's so cool.
I don't leave mine.
Oh, am I unmuted?
Yeah,
Yeah.
sorry, you're playing with your kids.
No, actually. So yeah, sorry.
No, it's
No,
okay.
Sorry.
Late.
It's all
Um,
good.
So, like I said with the case review, I won't tell you how it happened, but it's personal. Like, so my wife had an event. Oh, let me share my screen so you guys know what I'm like giggling at. That's not really funny what it is. So my wife had an event early spring, and so this is kind of what I'm giggling at right there, the eyeballs. But this is with what one of her first MRIs was. I'm just kind of playing with it, but there was something I did to it that was made it even funnier. Let me see if I can- So yeah, it was like showing it how to, where the scan is, like, so this, like, if you went back into you can see my screen, right?
Yes.
Mhm.
So, the scan on the right is like sagittal plane, right?
Okay.
As a view, so it's like looking at the side, so like looking from her left to her right, and the front one would be a transverse. It's kind of looking down, I think. Definitely looking. Nope, it's looking front to forward. Anyways, so I digress. We're going to talk about neurological emergencies, right? I'm not going off, I'm going off slides, so if we mess up, but I studied, make sure like I get what I need to get done. So we're gonna let me close one of these and leave open one so we can look at the physiology, A&P of the brain, because that's important. So it's not every day you get to look in your spouse's head, so it's kind of interesting to me and cool, and it is to her in a way. So what? Can you see my mouse at all?
Yep.
And I do have her full permission to view this. I asked her earlier.
That's good.
So I would disrespect her like that. So what this is a cerebellum. Right? Let me make sure I'm saying this right. Cerebrum, the white part of
Yep.
the white part. Like, this is more of the emotions, the cognitive thinking, memories, and stuff like that. Correct?
Yep.
Okay. Like this right here, that big. That's the cerebellum.
And the brain stem's in the middle.
Right here's the brain stem, and this would be the spinal cord going down,
Yep.
and this is would be or magnum. Is it not going to show it here? Yeah, forearm magnum, where the spinal cord goes down through the body to the spinal canal. Right, everybody with me?
Yep.
Any questions, comments?
Nope.
So yeah,
So like this white part on the outside, that would be her skull, and this would be like the dura mater, the lining on the outside, and like the cushioning around that kind of like a black part would be the CSF. So here's her nose, mouth, oropharynx, nasopharynx, stuff like that. See if I can get. No, I don't want that one. I want this one. Oh, I'm giving it away. This one. So here, see if I can get a good picture of it. So those are eyeballs. Looking for ventricles. Doesn't have it. Okay, like right here are ventricles. So this is kind of looking through the back of her head, like
Yeah.
frontwards, right? So again, here's the cerebrum. Here's the skull all on the outside and the scalp. Those are ears. So this would be the magnum, and there is one. And you see how this line right here,
Yep.
this line is it should be like up and down, perpendicular, like straight up and down, but it's shifted over a little bit, and that's not supposed to be like that.
So some kind of swelling or something.
Right. There it is. So we're gonna when we first went to the ER, they thought she might have had a stroke because some of the signs and symptoms that she was exhibiting. Do you know what? Does anybody know what they are for stroke signs and symptoms?
Well, like
Speech
facial
droop.
droop, or
Yes. She didn't have that
Words.
stuff, but
I
Speech,
love
unrecognizable speech, like weird words.
right.
or
So
slurred
facial-
speech.
So yep, slurred speech.
Hands.
So hemiplegia, like where she, like one of her left side was starting to go numb, and she had decreased sensation on one of her left side as well. She didn't ever really have difficulty eating, sleep, or swallowing, but those are also other signs of stroke. So she for a long time, ever since I can remember, she had headaches, like regular headaches, that would come on like a week at a time, then go away for like a month, then come back again for a week at a time, which is not normal, but like a headache is a headache. Not everybody gets them, so like you can really say like it's just a headache. But like when somebody like has a thundering clap headache, or like this severe headache where it's they just can't move, they can't function, it's the worst headache they've ever had in their life, it's crippling, that would be like a sign of an aneurysm or a ischemic hemorrhagic stroke, because of a burst blood vessel and it's putting pressure on the brain, right? So they also can have dizziness, weakness, they can become combative. I have no idea what that last word is. I can't read my own writing. Anyways, so like a whole bunch of cognitive issues can occur just from like having strokes or whatever is wrong with the brain. Any questions, comments so far?
No,
No.
we're good.
Okay. So you have signs and symptoms of stroke. There's two types of stroke. What are they?
Ischemic.
Ischemic.
and
Ischemic.
hemorrhagic.
Hemorrhagic stroke, right? What are the differences between the two?
God.
Ischemic
Hemorrhagic.
occurs when blood flow through the cerebral arteries is blocked.
Say that again.
Hemorrhagic is blood vessel ruptures and accumulates
Right.
blood.
Yes. So it's kind of like an aneurysm as well. Okay, what's an ischemic stroke then?
That's when the arteries are blocked.
Blockage. Isn't there a blockage? No.
Right. Yes. Yes.
Okay.
Blockage. What are the two different types of blockages?
Ugh.
Thrombus and embolus.
I was gonna say one from a clot.
Yep. Thrombotics or embolus. Like a thrombotic is like when it's at the source, like they have the plaque building up in their head and then finally just shuts down. Embolus is like when it travels from another part of the body and it goes up and gets stuck.
Okay.
In the remote area. Yep.
So as providers, there's nothing, we don't treat either way differently. Like they're a stroke, we just get them to treatment as quick as possible. So I'll tell you, like events leading up to March 26th when the events started happening, like she had significant increased signs and symptoms. Like she would just drop coffee cups, several of them. Especially if she'd grab them with her left hand. She became very irritable, like almost combative. What else was going on? Dizziness. Yep, she had retrograde amnesia. She was confused. She had periods of time that she just couldn't recall whatsoever, like blacking out. So it could all be kinds of stroke. So then on one Sunday afternoon, she was hanging up lights. I was at work, and she was hanging up some LED lights in my daughter's room. And then all of a sudden, apparently, she just started having a seizure. So that was a new onset symptom. And she was trying to see like a doctor before this, but so she had a seizure symptom that lasted maybe a minute. And I think that one was a general seizure. And so there's like different various kinds of seizures. And one was a general tonic-clonic seizures. That's when the whole body will start seizing like really bad, like from head to toe. And they usually last like up to 5 minutes, but usually they come and go. So like my daughter like got a hold, like didn't call 911 like she probably should have, but she got a hold like of her aunt or my wife's sister who's an EMT and another person. So we got her to the emergency room. They did a CT of her head, and so it was discovered like right here. Do you see this gray matter right here?
Yep.
So they initially thought that was blood, right? Because usually on CTs, like blood shows up as kind of gray. So they thought that like I beat her up and like she had a subdural, right?
Jeez.
Or then they thought it might have been an ischemic stroke, depending on the time. So she got transferred out. Anyways, so she got transferred out to a tertiary care facility, and then they just charged her home. And then the next day, she had a brilliant idea of going for a run. And so it increased her ICP. And then that night, she was vomiting, which is another sign of like ultimate or stroke or aortic or dissection, aneurysm. And then so then like I sat with her, and all of a sudden like just her right side started seizing, like her right arm, or like first it was her hand, her eyes, her hand, then it's kind of worked its way down, not to a really full blown seizure. It was more on her right side. So that kind of seizure is called a focal seizure, like only with part of the brain is being affected, because whatever was on her left side was pushing against the right. So like her right side was getting affected. So like she was seizing on the right side. Okay, she was seizing on her left. Yep, you're right. So I do have this backwards. She's right. I get corrected. Whatever this is right here is on her right side, and so she was seizing on her left side. So we ended up into the ER again, and then finally we got transported down to Boston, which they're the elite of the neurological world.
So at this point, they still think it's blood. They don't think it's something else.
No, they know what it is, but I
Oh,
haven't
okay.
involved. I was hoping you guys could
Oh.
figure it out from her signs and symptoms.
I mean, okay.
So what do we got for signs and symptoms?
Vomiting.
Vomiting,
Seizures.
like
Headaches.
new onset seizures, chronic headaches.
Headaches. Change in. You said she was irritable, so that's like a change in her mood or
Yep, mentality.
Did she have drooping and issues with her left? Did right?
She had no facial drooping, but she did
No.
have hemiplegia. Like her left side was much weaker than her
Weaker,
her
yep.
right.
Yep.
Especially later, like when this all started, it was significant. I could tell.
Sudden weakness or numbingness in the face, arm, leg, or one side of the body. Yep.
Right. So any guesses yet?
I'm guessing it's a
Tripping.
tumor.
So tumor. What else could it be?
I think she possibly had some kind of stroke.
Could be a stroke. That's what they thought originally.
Headache. Stroke. It's in this. It's got to be in this section. Seizure. She had a seizure. Yeah.
So there's like, where is it? The AEIOU tip. That somewhere. I wrote it down. Yep. So and like
She had a subdural. She had a bleed.
could have been
A
a bleed.
subdural
That's what.
hematoma.
So they thought it was that too. Like the X-ray tech like swore that she had a subdural, and like she was kind of not nice to me because I didn't know what was going on. Like I knew, but I didn't. So like for the AEIO tips, like what causes seizures or altered mental status, it's like alcohol, epilepsy, endocrine issues, electrolytes, insulin, and she's not diabetic per se. She doesn't do drugs.
Bulimia, trauma, infection.
Right.
Yep.
Poisoning, psychogenic, shock, stroke, seizure, syncope, space occupying lesion. So subarachnoid bleed, or hemorrhage, and delirium, something else. So Jen is right. She had a tumor, which was, and she had irregular periods too, which never gets covered in his, or probably wouldn't. Like she'd have a period, and not that Jason would know. Sorry. Like she'd have a period, it would go away for a week and then come back for 2 weeks. It was really awkward, weird how it would work. So this right here, this gray matter. Why is this not plugged in? Stand by one.
I think my old boss had the same exact thing that your wife is that you're talking about.
Oh really?
Yeah, he had a tumor in the front half of his brain, and he had to have it taken out. Well, he had his taken out. I don't know what you guys did. But.
Oh, she had hers taken out. Well, apparently I didn't have my computer plugged in. I thought I did. Come on. Yep, there you go. Yes. So in Boston, she did have it taken out. So originally we got transferred to CMC. And I'm gonna put it in the chat of what kind of tumor it was because I will never be able to pronounce it. I can find it. There you go. So in the chat is what she had
Yeah.
for a tumor.
That's a tough
Yeah,
one.
yeah, she could probably spell it. Like she was like very, very smart. And then looking back, you ever seen the movie Michael? Yeah, it kind of reminds me of that. But it was much tragic in there. So she had a tumor, that kind of tumor, which apparently, according to them, it's very slow growing, and she's probably had it since she was 15.
Oh wow,
Wow.
that's crazy.
Hold on a second.
You guys want to hear what the name of it is? Ready?
All right. So we went to CMC. Do you guys know where that is? I know Jen does. Yeah.
Yep.
So it's the Catholic Medical Center. It's a tertiary care center. They diagnosed her with that, and they kind of thought it was that when we went to the ER and AVH, as well as the stroke. They couldn't say for certain either way without an MRI. But then they discharged her home. I don't know why. So that's when she had another seizure. It was pretty hellish for a day or two, and then that's when she got transported to Boston. And so when they went down to CMC, so if you ever suspect stroke, do never, ever, ever give aspirin because that delayed her surgery for a week till the Boston wouldn't even touch her because of the aspirin. Just because one aspirin, they wouldn't touch her. So they did surgery about a week later. Let me pull up her most recent. Where is it? MRI. So this is this one we had down last. We have to. Well, we don't have to go down every 6 months now. It was every 3. Maybe come on. I don't think my internet connection is gonna let me do it. Here, let me kill my camera. Maybe that'll speed things up. Come on, baby. There you go. All right. So again. Oh shoot.
Oh, he's gone.
No, I'm here.
Oh,
All right, I'm still here. Sorry.
okay.
So this is the transverse view of our MRI, the bottom left, and I guess the bottom right too. And they're both without dye. So here's like another picture of the foramen magnum, the opening of
You're not sharing your
below,
screen.
I can't,
like
we
where the
can't see
spinal cord
anything.
comes in. Oh my God, I can't. What's that?
We
can't
aren't
see
see
your
all we
screen.
see.
So like this is her teeth. Like not just cool to now look at. So these are obviously her teeth, her soft palate, her spinal cord, like
Can't
her
see your screen.
cheekbones.
Still
What's
can't
that?
see you. Still
You
can't
can't
see
see
you.
your screen.
All we
So
see
I'm
is
gonna-
you, no screen.
All right, better.
No. Yep, better. Good.
Here's her teeth, her top teeth, her palate, her tongue, her cheekbones, foramen magnum, and here's like the spinal cord, right? So this probably be her tongue. So I was gonna kick out of the eyeballs. Those are her eyes. So here, again, here's her brain. So remember how that line on the other was shifted. Now this is like pretty much straight up and down. Though these are ventricles again, that's what pushes the fluid, the CSF, and it gets down into and it regulates the cerebral spinal fluid in the brain. We're going the wrong direction. So here's the cavity of where they took the tumor out.
Oh.
So here's again, like this would be the right hemisphere, and this would be the left hemisphere. Right, yeah. And so here's like, she had a 6x6 tumor, millimeter. Centimeter. It was the size of an orange in her head. So this is the cavity that's there now. Like she has just literally a hole in her head, and it's just filled with fluid where her brain once was. Let's see if I can get another view. Come on. So this is like looking from her left side, looking into her right. So here's like the cerebellum, cerebrum. So this would be the skull. This is like where we think this is either where they went in, or a plate. So this is like would be the skull all the way around here. This is where they did the surgery. Like she had a scar from ear to ear, but it was like only over, and they pulled her skin down. So this is with dye, obviously. And so this is like the other view, like a side view, the pocket where the tumor was. So do you see how it's missing right here? Here's the cerebrum right there in that pocket. It's missing. So like she's missing a quarter of her brain. And it's the brain that manages emotions. And now that she's gone, if you ever hear her screaming at the kid, it's like the kid that's overtired at her, she's overwhelmed and doesn't know how to cope and can't manage it. And it's hard. I feel bad. It's rough. But and this is a burr hole right here.
Oh, what?
And again, here's the eyeballs. And this would be like do you know what this would be called right down here where I'm pointing?
That's not the pituitary gland, is it?
I think it
No.
is.
Could be.
Either the pituitary or the medulla oblongata,
Oh, yeah.
or brainstem. It's all right there. So here's a burr hole, definitely. So yeah, now some of the meds that she's on right now for her seizures is Keppra, which is anesthesia. So if you ever see that on the med, there's another one, phenobarbital, which is older. They gave a whole list of meds. Klonopin was another one I saw. I don't know what else. So other causes other than tumor. Any questions about that? I know it's like probably a lot, and I think it's kind of interesting and sad at the same time.
Right.
Any questions about it? Like seizures? Do you want me to pull it back up?
No, I don't think so. So now that it's been removed, do all the symptoms go away?
No. Yes and no. She had to go to she did some weird stuff like after the surgery. It's been a kind of a long road. She still has weakness on her left side. Like Keppra causes the irritability. The tumor removal itself causes the irritability. Just where the location of the tumor causes the it's like where the emotions are regulated. So it's been kind of a challenge that way. but they put her on B6, and that I think has helped her a lot. Every day she has a headache, like because she's a school nurse, so she sees like a lot of kids and is always on the computer. So like two things that would definitely give any normal person a headache, but now it's elevated for her. She has photophobia. She's like all the time she wears sunglasses that like cut out UV rays, like every day. Just like in the house, she'll just wear sunglasses. But she's a lot better. When after the surgery, she like in what they call the left side of neglect. She couldn't she would ignore everything like on her left side. It was really weird.
I was just reading about that.
Yeah. So like one day the nurse, when she was in rehab, she had to go to rehab for 2 weeks before she came home, and like still like she won't probably admit it, but she doesn't like being home alone. But like the nurse put her meds on her left side while she was eating breakfast. And it's just like, okay, you need to take your meds now. And she completely ignored her. Like she didn't even exist. The pills weren't even there. And so she's like, okay, like you need to take your meds. And she was completely ignored her again, like eating her toast. So I'm like, you need to put her on her right side. And immediately I picked him up and put him on her right side. And she picked up the cup and took him like that. It was like the weirdest thing.
Wow.
And she like left the door open. Like her cook, she's a really good cook. And when she came home, like her cooking was, she had raw noodles, burnt chicken. It was like she didn't. It was rough, but she's like come 100% about. Just now, if you didn't know her very well, you wouldn't see anything. But like her left side still is weaker, she says, and she just does some quirky things. We just kind of go along with it. Like she put cough syrup in my kid's backpack for school, but it was like nighttime cough syrup. Like, oh yeah.
I laugh, but it's not funny.
Oh, I laughed because
Yeah, but that could be a common thing too.
She's a school nurse.
Yeah, you're right. She shouldn't have. Yeah, she shouldn't have.
Mistakes happen.
It happens.
But so she also, yeah, her short-term memory, especially when she gets tired, her deficits are like really noticeable. But she had to go see a neuropsych to go back to work, and the neuropsych guy and who's Harvard trained and her oncologist who's Harvard trained said she was a genius. So there's that.
That's amazing.
So other things that I just want to go over that besides tumors that cause seizures. So epilepsy, which is biological. We have a frequent flyer that we go to in Berlin. I don't know if he has epilepsy, but he certainly has seizures regularly. And he's cognitively impaired. I heard him talk. I don't know how many times I went to him, but I heard him talk once a couple weeks ago. Brain infection will cause it. What's that?
I was going to say, when my mom was really sick, my mom had a brain disease and she had seizures. We didn't know she was having seizures because there's no, like, her body didn't move. She didn't have tremors. She didn't have any of that. She just had this sort of like blank stare off into like no man's land. And then it was after like, 10 minutes or whatever, then she would just we couldn't figure out why she would be so like quick to fatigue. And it's just because she'd had this seizure that we didn't realize she was having, because there were truly, really, I mean, until we got good at recognizing what they were, there really were no symptoms. We weren't aware of anything. They just were, she would just be sitting there staring off into, out the window, and she'd literally be having a seizure.
Yep, silent seizure.
It was horrible. We felt terrible, but
yeah. So like sometimes like Devin, like her first few seizures are probably full on seizures. She can remember everything during them, but usually they don't. And you like after the seizure passes, especially if they're tonic-clonic, they are what they call postdictal. Did your mom do that with a silent seizure?
not really. Because she had obviously had other things going on because she had a brain disease, it was hard to sort of, she was nonverbal. She was, her frontal temporal lobe was like totally gone. So it was really
disease
hard.
did she have? If you don't mind me asking.
She had Pick's disease, which is also known as frontal temporal lobe degeneration.
I never heard of it.
It's actually what Bruce Willis is dying of right now.
I thought that was dementia.
Well, a lot of people call it dementia, but it's really not. Look up Pick's disease.
Oh, I'm doing it right now.
It overlaps with dementia, so it
Yep.
tends to just get thrown into what I call a trash can of symptoms. But it's not very common. It is a form because of it also overlaps a lot with Parkinson's. So they have
Yep.
like what they call Parkinsonisms. So like she had like the gait of someone with Parkinson's. But it just, yeah, it was hell. But when the seizures started happening, they were like, I was like, what do you mean she's having a seizure? Like, she's not doing anything. Like, it was just, yeah. And she would become, like I said, she'd become really tired afterwards. But then I noticed that like her left side, like she would like lean, like her left arm, she'd like almost always like put it out straight. Like,
oh, really?
Just kind of like out straight, like not really, it wasn't rigid. I could move it, but it was like uncomfortable. I don't know, it was weird. Yeah. It sucked. It sucked. But once you recognize the symptoms, you kind of go, okay, now we know she's having a seizure, and we just kind of protect her while she's doing it. Wasn't much we could do for it.
No.
Not really. No.
Sounds pretty familiar, actually.
Yeah.
Yeah, I'm sorry you had to go through that.
Well, thank you.
How old is she still here or no?
No, she died almost 3 years ago. She was officially diagnosed when she was 60, and she died less than 45 days after her 65th birthday. So 5 years.
Did she stay home the whole time or no?
My dad and I took care of her the entire time.
Oh, wow. That's dedication.
Without any help from the state of New Hampshire, by the way, because the state said she was not disabled.
Holy wow.
Yeah. That's a whole nother story. But yeah,
right.
we did. My dad and I took care of her. She was 24/7 for a little over 3 years till she passed. So not that it, yeah, but the whole seizure thing is like, I didn't realize people could have seizures without like shaking.
Yeah, there's different kinds.
Yeah, but I mean, it doesn't really matter what the seizure is. The after effect can alter someone so differently that it's just I just was totally unaware. So I would think it would be huge in the, in anyone's world, EMS, whatever. Someone has a seizure, the after effects are, how do you treat that if you don't really know?
You can't. Usually, like people who do like have a history of seizures, they know, and they're either medicated and they'll go about their way. They don't want to be treated or transported, but some that don't. But like I had a patient once who's kind of similar. It was a long time ago. I would ask him a question, and he'd start answering me. Then all of a sudden, he'd just stop talking and he'd just stare off. And then he would start talking again, like he never missed a beat. And I'm like, oh, and it was a silent seizure, and I think that's what it's called. And and so I called for a medic in case he really started seizing, and I didn't know what it was, other than something was going on.
Right. Wow.
But no, that's impressive with your mother.
Long road.
Any questions about that? Seizures. So post-ictal, I think we started on it. Apparently Jen knows what it is. So I don't know if Jason does, but like when somebody has a seizure, like their brain's pretty scrambled. Like they burn off a lot of like energy. It takes a lot of energy. Devin said after, like she was aware everything was going on. She said it was the most painful thing she's done other than childbirth. Because like the body is just twitching and it's using a lot of energy, lactic acid buildup. So when people come to though, they're like altered. Their brain kind of resets, and so they're altered. And it says like it takes about as long as a seizure lasts for them to regain like full to 100%. So if it's a 5-minute seizure, they're gonna have a 5-minute postictal time.
You
have a
know,
question?
Morgan, I've never seen anybody have a seizure like a person, but I had a dog that had a lot of them towards the end of his life, and all of what you're talking about happened to this dog.
Yeah.
It was you saw all of that. Like after he just calmed him down, while he was seizing, you just tried to make sure that he was safe, and you couldn't do
Yeah.
anything. You just sat there and waited for him to be done. And then right as soon as he got done, then you would have a little while before he would actually get up and start walking around. And he never bit us he never like was aggressive towards us, but after that, he was a different person. Like he was a different dog, until
Yep.
like you said, 5 minutes or so, and then he was fine.
Right. Yeah. Usually people they have this dead stare looking. They don't. They're home, but they're not home.
Yeah, totally the same thing with him. Wow, that is so weird.
Yep.
And the longer somebody has a stroke, I don't. Is this true in humans too? So our veterinarian told us the last stroke that he had it so long that like his temperature went up and it did something to his brain.
A
Is that
stroke or a
does that
seizure?
happen? A seizure.
You said
But
stroke.
no, well,
Yeah.
I meant seizure. I'm sorry. You
So
just had a
yeah,
seizure.
you're like it says in your book. Even I remember reading it. Their temperature does go up because your body is exuding so much energy in a short
Yeah.
amount of time, like all over your body, depending on the seizure. Yeah, they're usually flushed. And
Isn't that
temp will
called
go
a
up.
grand mal or something like that?
Yep, tonic-clonic grand mal. And if somebody's like seizing more than 5 minutes, it's called status epilepticus.
Yes. Yep.
Or if they have several seizures, like over like a half an hour, and usually they have to be intubated because just to get their body to relax and start over. So they need to get to the hospital as soon as possible. So other things that causes seizures, well, we talked about epilepsy, like congenital, structural. So
Yep.
like my wife had a brain tumor. Jen's mom had an infection. So like Devin has to be on Keppra for, I thought it was gonna be the rest of her life. The oncologist said something different last time, so we'll see. But so like her brain's like has scar tissue in it. They carved that tumor out. So she's probably gonna be on Keppra, which is for seizures for the rest of her life. Head trauma, like for subdural bleed, is what they thought that like I hit her over the head with something
What about
at the hospital.
like I know I haven't fully finished reading the chapter, but I know sometimes babies get seizures when they have a really high fever.
Yep,
Is
that's
that
febrile.
like okay? All right.
Yep. So and it's not the fever, like the increase of temperature that does it. It's like the sudden onset, like when they go from nothing, like they're fine, to like 104, like that. That's what causes the seizures in babies, or the young people.
So the jump.
What's that?
So the jump, not the temperature
Yep.
itself.
It's usually the jump.
So a gradual rise in a pediatric fever wouldn't necessarily cause a seizure, is what you're saying.
Right.
Okay.
Right. So, but if any seizures like in a kid, my first thought is going to be febrile. Then probably, unless, and they're going to be known, hopefully, if they had any prenatal care or whatever, or pediatric care, if there's a known cognitive issue or seizure. So if it is febrile, you just easily like take a temperature and try to cool it down.
Yep.
The best you can. So hypoxia, obviously, because that's going to be starting affecting the brain and brain death. Hypoglycemia. I don't know if I've seen it, but that is something that like every patient that we come in contact with who has a seizure, they get a blood glucose reading. But yeah, I think it's anything that has to do with the brain will cause seizures. Poisoning, drug overdose, and definitely sudden withdrawals from alcohol. And it is like when people like all of a sudden stop drinking, that's like the only withdrawal that will kill people is alcohol. And it will cause seizures because the brain and the body's just so used to it, and then all of a sudden it's just non-existent. Any questions on seizures, tumors, causes, treatments?
I lied. I did see somebody have a seizure. I was watching The Deadliest Catch, and a guy fell down through a hole in the floor. It was a purposely made hole. You go downstairs. Well, he fell down those stairs and he hit his head right in the back of his head on a piece of metal when he fell down, and that force, they said, gave him a seizure, and he started seizing. That would be
Traumatic.
Trauma.
Yeah.
Traumatic.
Trauma. Yeah. Yeah, it was bad. Trauma. Yep.
See if I caught everything. I did. So general seizure we talked about, focal seizures, brain vision. So yes, I didn't mention auras. So my wife, I don't know if your mom probably didn't know if she did or didn't, but my wife, like, once she started having seizures, she could tell when she was gonna have them after that, and it's called an aura. And she said like she could see visual, like she could see stuff. And then she knew.
Well, I have to tell you, my mom, she had very few words. I mean, she, as her speech did, but she did tell me one time that, and of course I thought it didn't make any sense because the sentence itself doesn't make sense. But she said to me, I always feel like my brain is falling. And she would like touch the top of her forehead, and she would say, my brain is, she'd be like touching like near the bridge of her nose, like the top between her eyebrows. And she would say, that's where my brain is. And then I think they were that was her way of telling me that like she was feeling something, but because it didn't really make sense, we were kind of like, because her words were so gibberish that
right.
I was like, yeah, Mom, your brain's not falling, I promise. But I think that was her way of telling me she was feeling something.
Probably.
Couldn't really articulate it.
Yeah. Oh,
You know?
Yes. Yep. So like Devin says, yeah, an aura, like Jen's mom, in a way, had maybe an aura, like her brain was falling or whatever. Devin said like she saw, like, I don't know if I can't remember if she saw spots or if it was something. I remember her saying that she saw something. I can't remember exactly what, but there are like also other hallucinations that people can see. Also, that there's visual changes. There's like changes in taste or whatever. Oh, blinding spots, flashing lights, and like seeing and smelling and hearing things. I guess people, because like it's your brain that's it tells all, sees all. But I don't ever remember her saying that she saw or heard. She saw. I don't remember her saying that she tasted or smelled anything. So sometimes like she did not. She's not here. We'll talk. She like people who have full on seizures will urinate themselves or like void urine or poop themselves.
Yeah.
Yep. Because they can't control
Yeah,
themselves, their muscles, so they just let it go. So the signs and symptoms of a seizure: muscle twitching and like rigidness, tachycardia, tachypnea, sweating, increased salivation, because that's that foam coming out of their mouth, right? Sometimes they'll bite their tongues, so they'll some bleeding or the sides of their cheeks. And we talked about status epilepticus. I can't say it right, but so that's like seizures that last over 5 minutes, like, and then or like series of seizures over 30 minutes. So how does one treat? Walk me through a patient assessment and like treatment for the seizing patient.
Scene safety, BSI, And
Maybe.
then you want to protect the patient from hurting themselves and maintain an airway, I would think.
Right.
I guess you'd need to determine, I mean, unless you already know, but wouldn't you want to know like what type of seizure they had, or like
Yep.
what was, what led up to the seizure?
Right.
Clues that help you determine the nature of the illness. Yeah.
Like what, I mean, I'm assuming, well, no, maybe no one knows what kind of led up to it, but I guess you could ask that question, what led up to the seizure?
Right. So yeah, scene safety BSI. We're gonna when we're walking in, like we're just looking around, situational awareness to see if like any clues of what's going on. Is there any meds? Like what kinds of meds? If there are any seizure meds or diabetic or glycemia, like
Right.
So there's a history or no history. And we can look for medical alert bracelets, ask for bystanders that are on scene. Yep. And Jason said like there's really nothing we can do except to sit back and watch, more or less, like, and protect their heads. You can put high flow oxygen on just because they're not going to be breathing effectively. We're not going to be putting anything in their mouth because that's not good. But we can put like supplemental oxygen for what they can breathe. We'll get it to them. We're just, once they're done, if there's like any extra secretions that they're not clearing themselves, we can suction or clear it out. We just transport, like do a secondary assessment and transport to the nearest hospital, appropriate. I mean, watch vitals every 5 minutes. Any questions on that?
No, I don't think so.
So stroke, we started with stroke, right? The two different kinds are hemorrhagic and ischemic.
Yeah, the other one.
One's a bleed and one's a block.
Yep.
Yep.
We talked about that. So yeah, Ebola. So what's a TIA? Did anybody read about TIAs?
Yeah, stroke.
Attack.
What's that?
A trans ischemia attack.
Right. Which means
I
what?
said that right.
You did.
It's a well, it's a blockage of some kind. It's escaping me. It's like a small stroke, a small stroke.
Right.
Yeah,
Call them strokes. Yep.
So the book described it as a like angina for a heart attack. An angina is when
24 hours.
Yeah. So angina is like when the vascular system in the heart, the oxygen demand like is more than what the heart's getting. So once you rest, it goes away. It's the same thing for the head, or for the brain. Like if there's an oxygen demand that's not getting through, like they'll have stroke symptoms. And a lot of times, like when we'll get called for strokes, and then we get there and like, oh yeah, he was slurring his speech and he was mumbling or he was facial droopage or whatever. And it's probably like that when we get there. But by the time we get to the hospital or whatever, the patient's perfectly fine. It's totally reversed. So it's just the stroke that's happening that's like kind of resolves on its own. But it's important to get these patients to the hospital because it's a precursor to the big one. So, yep. So also like things that could cause a hemorrhagic stroke or hypertension, or just stroke in general, is hypertension, cholesterol issues. So like people who have hypoglycemia, they can like act like they're having a stroke or whatever. Like I think I talked about it on Sunday. Kim, you weren't there, but when we went to responded to somebody who was in a bar who passed out like all of a sudden, and so they called for us, and I was on with the medic, and he was like kind of a dick about it. And he's like, either you gotta go with the cops or you gotta go with us. Like there was no assessment involved, and he ended up having a stroke. Yeah, just because he was at a bar, like everybody thought he was drunk. But so we can never assume. Third speech. We went over the signs and symptoms. Went over that. Is there anything that we didn't cover that I'm missing so far? Oh, so patients with some sort of altered mental status they could have delirium, and it's kind of like psychosis, and they're just it's not a disease, it's a mental cause. Like they think they really, I don't know, are in another world. They aren't with reality. And the stroke scale. I think they talked about what's that?
I forgot about the scale.
Yeah. So yeah, I know the Cincinnati. That's the way I was always taught and brought up. I can't spell Cincinnati.
CINNI.
Facial droop, arm drift, and speech. CINCINNATI.
I know the Boston Stroke Scale, or the. So, like, basically, when I was kind of coming through, like, we knew the Cincinnati Stroke Scale, and all that really showed was, are they having a stroke or are they not having a stroke?
Yeah.
So, what we look for was facial drift, droop. If they're slurring, you could say, this, you can't teach old dogs new tricks. And like if they'll slur it if they might be having a stroke, or if depending on where it is, they could be having aphasia and not be able to speak at all, or talk like in weird words that don't even make sense. I guess kind of like Jen's mom, but it wasn't a stroke; it was something else. So and then like arm drift. So we'd pick up again, like we did the neurological exam. We talked about it a little bit with the backboarding. It's kind of the same thing. You would have them squeeze your hands and then pick up their feet, push down on your hands, stuff like that. But you also like put their palms out, hands with palms up, close their eyes, and if one falls over the other, that would be indicative of the stroke. But now we go by, let me see if I,
excuse me,
the stroke scale, or like how significant of the stroke is and where it is. And I guess it gives where it is. Is it in here? Secondary assessment test. That's the Cincinnati. So this is Los Angeles. Severity scale. So it's kind of the same thing. So yeah, the same. It's basically the same thing, but you're adding in like if I show them a fork and they say, "Yeah, that's a fork," and then they get like 2 points or a point. I can't remember what it was. I'd have to look. Or if they can identify, if they can talk or whatever, and how alert and oriented they are with it. And one we do use all the time is the Glasgow-Coma scale. We use it for billing. So
use it for
like
what?
Billing or billing, like if we put somebody who's alert and oriented and put their glass or not oriented and they can't sign, but we have a like Glasgow Coma scale of 15. We get the report sent back because they can't bill it supposedly. So documentation is important. So like it's basically looking at alert oriented of the patient, and like we're kind of scoring it as we're doing it. And it's so like if somebody walks up to you, or you'll walk up to a patient and they like look over at you, so they're like alert to you, spontaneous, or if they're just kind of like staring off, and then you have to like, hey, what's going on? And they then look to you, then that's verbal. Or then you push on their chests or cause painful stimuli, then they do whatever, and none is a point. So when they respond, is it oriented, or do they make noise but they don't really know what they're talking about? Like if you ask where they are, I'm like in Errol, New Hampshire, that would be right. But if I say I'm in Boston, I'd be confused. They can make inappropriate words, like they'll just make words but they don't really make sense, or they'll just make sounds like aphasia. And so they will obey commands. And I put these all in my reports, actually. They obey commands or follow directions, localize like pain, withdraw from pain. Like they'll flex, which I saw the other day where it was kind of fake, or they'll extend all their, and that's bad. That's usually with, well, this is all brain, but like flexing and extensions are like, extensions are probably not coming back, and flexation is like there's significant brain injury involved. So yeah, like I guess we kind of went over this: protect them from harm, maintain clear airway suctioning, provide oxygen as quickly as possible, make sure you provide spinal immobilization if you can. If they like fall, usually patients will be able to tell if they're having a seizure, so they'll protect themselves. But if they don't, you need to make sure that you immobilize them the best as they can. Suction the airway you best as you can, provide positive ventilations. And if there's status epilepticus, get them with ALS or call for ALS. So yeah, the hemorrhagic, not hemorrhagic stroke, but aneurysm, brain aneurysm is a sudden onset of a severe headache. With photophobia, seizures could be altered mental status. And we had like one of Devin's classmates died. He got hit in the head with a beer bottle, like he was a bouncer, and he had a aneurysm nobody knew about, and it killed him. The beer bottle. And I had a friend, like somebody and it used to be an EMT. She had an aneurysm. That was her first, like her only symptom when I was there was a sudden headache. So yeah, there's different kinds of headaches too. I forgot to mention. So like a migraine, like which is caused just by stress or whatever, and the changes in cardiovascular system, like in the head. Usually, like they want, like anytime there's somebody like had the headache, I always dim the lights as much as possible and try to keep it as quiet as possible, because obviously now, and never use lights and sirens during transport because it's like irritating. Use X's, ABCs, transport to the nearest stroke center, keep SaO2 above 94%. Oh, somebody's going out.
Sorry.
Don't be. So same as we talked about the care about seizures, like just post-ictal state, they're going to be like lights on, nobody's home. Protect their heads. Don't put anything in their mouth. Altered mental status, because a lot of different things cause altered mental status. So if there's trauma involved, like meningitis, I did mention that. That can cause altered mental status and brain injuries. But that's like where they have neck pain, head pain. But they usually have a fever for bacterial meningitis, and it's very contagious. So that's when you should definitely be gowning up in respirators. You don't want that, or you'll be on antibiotics too. Provide airway support, ventilation support, and transport for appropriate facility. Any questions, comments? Clear as mud. Was the case review good or not so good, like my wife?
It was
Was it better
very
than
interesting.
slides?
It was good.
It was.
Yeah.
For her. So a 41-year-old, you want to do the review now? Then we'll take a break.
Sure.
Yeah,
No,
let's
just
do that.
do the re-
We still got
All right. A 41-year-old man presents with slow, irregular breathing, hypotension, dilated pupils. These signs most likely indicate dysfunction of the brainstem, hypothalamus, cerebrum, or cerebellum.
I would think the brain stem, but I could be wrong.
I think it's the brain stem.
I think it's a
The
Brainstem.
brain stem, that doesn't it do like all that stuff? It, like, regulates breathing and nice.
Right, you guys are good. The brain stem's responsible for functions of breathing. Yeah, we kind of talked about going over the test. And I'm gonna look that up. There's a term.
What?
What causes, like, on a normal person? What it's the? No, I'm just getting too tired. I don't know. I'll look it up. There's a term that says for like the hypoxic drive, the opposite of the hypoxic drive for somebody who what makes them breathe. So acute ischemic stroke is caused by, so the key word is ischemic, a ruptured cerebral
Blockage, right?
artery. Yep. Increased
D.
cranial pressure. That would be caused just this headache or a sinus headache. Acute rise in a person's blood pressure. Blocks cerebral artery. Yep. D.
D.
Hey,
D?
Morgan, is it hypercapnic?
Nope. Acute ischemic stroke, yeah, is a blocked cerebral artery. So like if somebody gets a blockage in their jugular or whatever this one, that would cause like a whole hell of a lot of problems. And if does anybody ever go to the doctor, their yearly physical, and they listen to their jugulars?
Yes.
No. Oh, mine
Go to
does.
the VA, they don't do nothing for me.
Are you talking about eupnea?
No.
Eupnea?
Maybe
That's
I'm
normal
making it up in my
breathing.
head. Huh?
That's called normal breathing.
Is it? No, maybe you're right.
EUPNEA. I don't know. Sorry, I was trying to help.
56-year-old man experienced a sudden severe headache and then became unresponsive. Oh no. He has a history of high blood pressure. The most likely cause of this condition is hemorrhagic stroke, very could be acute ischemic stroke, severe migraine headache, transient ischemic attack.
It's not C or D. I think it's sudden headache and most urgent high hip blood pressure. It could be A or B. I don't know.
I'm gonna go with A because the
Crash
severe
diet.
sudden onset. That's a hemorrhagic or the aneurysm.
But isn't acute means severe sudden onset?
56 acute. Yes. So yeah, this is like one of those tricky questions, I guess.
Yeah. All right. Well,
He's
I think it's either A or B for sure.
they're really not giving any indications of a stroke, so that would be ischemic. Ischemic stroke. It could be a severe migraine headache, but like I've never heard of anybody going unresponsive from a migraine. I've heard of other symptoms they have. A TIA is kind of like a stroke. but the sudden onset is like an aneurysm or hemorrhagic stroke.
Okay.
That's when it bursts in your head and it just creates a lot of pressure.
Looks like you were right.
A dead clock's right twice a day. Unlike an ischemic stroke, Unlike an ischemic stroke, a transient ischemic attack is characterized by all the following except symptoms that resolve within 24 hours, symptoms that persist for longer than 24 hours, weakness or paralysis of one side of the body.
B.
Yeah, B, because TIAs don't last more than that. So I'll accept B.
Yeah,
Right.
They try to trick you with that question. You guys did good. B. Because TIAs don't go over 24 hours, hopefully. A patient with a suspected stroke presents with slurred speech that is difficult for you to understand. This is referred to
A.
A.
Either A or B.
Yeah.
I think it's A.
So A, I did write this down. I probably didn't talk about it.
Inability to understand and or pronounce speech. Words.
Right.
B,
So there was
inability to understand or
receptive
pronounce.
aphasia. Right. So it could be A or B. D
Right.
means difficult. Like this means difficult. A means without.
So if it's difficult, I would say it could be B then.
And then C means swallowing.
Right.
What?
We're
This-
all wrong.
Can you go back to that the question again? Patient with a-
Patient suspected
What the
slurred
hell?
speech
Difficult to
that is
understand.
difficult for you to understand.
And
This is
D-
referred
this-
to
this,
dysarthria. What?
That's a new one for me.
Word speech. I
thought that's what aphasia. No, because aphasia means they can't speak.
Yeah.
Yeah, no, my mom was aphasia. She was aphasia. She couldn't speak. So I should have known that one. But I would have guessed it was definitely B. Difficulty
Inability to
speaking.
understand and or pronounce or produce. Not pronounce, produce speech. Yeah, all right, it's D. Damn it. All right. I talked you guys into it. I led
You
you
did.
off the cliff.
You led us.
Led you right off the
Led us
cliff.
off the
So
cliff.
what? So what? I guess I missed it. We're okay. So
Well, 'cause
dysphagia.
The actual definition of D is slurred speech. Like there's only 2 words in the definition. Slurred speech.
Oh.
Definitely gotta be right.
So that would be B.
B.
As well.
Dys-
Yeah, no, B is dog.
Arrhythmia.
Whatever.
Let me look up what dysphagia looks like because it's not in the book.
Well, it doesn't. It
Dysphagia?
does,
Well, there's
so
two
it's-
different dysphagia. There's dysphagia speaking with an S,
Yeah.
or S for speaking. Difficulty S for dysphagia, the difficulty swallowing. So they again, that's like 2 good answers, 3 good answers. And they throw a curveball. Welcome to the National Registry.
Ugh.
Hey, we'll remember that one if we ever see it though.
You will. They'll have the other answer.
Yeah.
So anytime you see the word the slurring speech and you see that word, that's would be. I would go for
Yeah.
that. A type of seizure that is characterized by severe twitching in all body muscles and lasts for several minutes long or longer is called a partial seizure, B absent seizure, C focal seizure, D generalized seizure.
D, generalized.
D.
D. D is
Guessing
dog.
D.
Are we like the only?
What's that? The most important reason for properly transporting a stroke patient to the hospital is transient ischemic attack can be ruled out. medications can be given to reverse the stroke. Yes, I probably didn't mention that. They can give a TNK, which reverses the stroke reversal.
But it can
And you
only
have
be
a
given in a
certain
couple
amount.
hours.
Yes, you have like 3 hours. So when you see it go to a patient with a stroke, you need to make sure you find out when the last known well time was. Like if they did it, like she went to bed and she was fine and woke up and she had a stroke, they're ruled out. Like you can't have it. But if you like the symptoms started at 12 and then you get called there at 12:05, they're definitely within the window.
My father-in-law had a stroke. My mother-in-law came home and he was wandering around the kitchen, and she's trying to talk to him, asking him like, maybe what did they want for dinner, and he wouldn't answer him, and he was just walking around looking confused. And she finally called 911 and they brought him to the hospital and they figured out he had a stroke. But because we didn't know when the onset was, because nobody was there, they couldn't give him those drugs that you're talking about.
Yeah.
Which stinks. So that time is really important. Yeah. When
it is really important.
Yeah.
So properly transporting a stroke patient, TI can be ruled out. It's going to rule itself out. Medications can be given to reverse the stroke. We're going to go with that answer. The clot in the coronary artery may be dissolved.
Hopefully it's B.
D. So the coronary artery is in the heart, so we don't want to. They do have a medicine for that too, but that's different. He or she needs close blood pressure monitoring. It's going to be B, like Jason said. It's very important. Which of the following are components of the Cincinnati Pre-Hospital Stroke Scale? Arm drift, blood pressure, speech, pupil response, arm drift, facial symmetry, speech, arm drift, pupil response, facial droop, speech.
C.
D.
I think it's C.
C. Remember, it's the facial, teaching old dog new tricks and then putting their palms up.
Speech and arm drift.
It's a sunny day in Boston. What are the days of the week from Thursday? Never mind, that's a different. Your patient opens his eyes when you say his name. He's making incomprehensible sounds and withdraws when you pinch his earlobe. What is his GCS score? It's definitely not 12.
Just changed it.
It's not 8. So you'd have to write this down.
9.
You think it's 9?
Mm-hmm.
So
patient opens his eyes when you say his name. So 3. Making incomprehensible sounds.
It's 11.
7. Withdraws when he pinches the earlobe.
Who pinches anybody's
7,
earlobe?
8, 9, 10, 11. 11. C.
You think it's? Did you do it out?
Yeah, but I could be wrong because I'm bad at math.
Oh, I did it in my head, so it's A.
Who said
Who
A?
said 9?
Kim.
Kim.
Okay.
That would be Kim.
The guy gives us 3. Who opens her eyes to speech, right?
Yeah.
3.
Incomprehensible sounds is a 2. And withdraws the pain is a 4.
Which was 5.
3, 2, which makes 9. 5 and 4 make 9.
Yeah, I tell you it was
Good
the
job.
math. I did.
Kim gets the math award.
I hope I get 7.
I don't know. I have
Because you
11.
said you're not good at math.
But I was looking right at incomprehensible, though. It says it right there. Incomprehensible sounds 2. And 3 plus 2 is 5. I know what I did. I went 3 plus 2 is 5. And then I was like 5 plus 2 is 7 plus
You
4.
listen to me.
It's not good. Yeah. All right. Keep going.
If a patient complains of severe migraine, how should he be transported? In a brightly lit ambulance so he can see.
No.
Oh my God.
That'd
C.
be torture.
I would say C.
Right.
Unless he's an asshole, then maybe A.
C. Flying hypo if tolerated may be healthy. No, they won't. So C. All right. Let's take 10.
All right.
We'll come
We'll
back.
do 33.
Yeah.
Mhm.
Hey, honey. Equipment, very small track. I did. No. I was just petting my Labradoodle, and you could really do a 12 lead on him. You could definitely feel his intercostal muscles. Be easy. Not like on me.
My cats are pissed right now because the door's shut and they can't come in.
We had a monitor heater, propane heater, and a on-demand propane hot water heater put in today, and I had to lock my kitty in my bedroom because they were constantly going in and out, and I didn't want her to run out. So she was, locked in the bedroom for most of the morning. She'll live. We've locked her in the pantry every once in a while. We'll come home. It's so bad she'll be in there all day. And she
That's happened to us before.
get home and
So bad.
oh,
I'm always like, have you seen Romeo? My husband's like, no, not since. I'm like, you open the door and he like comes charging out. I'm like, oh my God, I'm so sorry.
yeah. Our coon cat used to go in there all the time. She used to get locked in there all the time, but she was very vocal. As soon as she got locked in there, she'd start meowing, and you'd get her out. But
Well, usually
one
they go in, like we're trying to get ready for work. You know, you run in and you run out and they follow you in and you shut the door and you leave for work and you're like, don't even know it.
Yeah. So have you guys done the questions for chapter 33? The questions that we have to send to Kevin? Have you done those yet?
No.
No.
Because I think number 3 is wrong. It says the patient has a respiratory rate. It was talking about what is it? Let me. You and your partner show up were called to a 25-year-old man who was found unresponsive by 2 hikers in a remote area of a national forest. On arrival, you observe the young man lying supine on the ground with liquor bottles nearby. Despite near freezing temperatures, he is dressed in a t-shirt and jeans. And it goes on to say that, he's in hypothermia and da-da-da. Then it says that the patient has a respiratory rate of 4 breaths per minute. Your partner assists ventilations with a bag mask device while you perform a pulse check. How long should you assess for a carotid pulse? I think it's 60 seconds, but it says 30 to 45 seconds. And I even looked all over the test. I looked all over the book again. And it says in people that are extremely cold with extremely low respiratory rates like that, you have to, or not respiratory, low.
Like
That's
pulse?
the key. Maybe that's the key. They weren't talking about pulse. But it says in here that in some people you'll have to check them for 60 seconds. I don't know. I'm leaving it. Kevin can give me it wrong if he wants to.
Sorry, I was
Another
muted.
thing,
Talking,
another thing is, it says that you come up to a patient that was on the ground, hiking on the ground, and they have a bottle of booze beside them and they're unresponsive. It asks, after establishing unresponsiveness, what should your next step be in patient management? Provide manual inline stabilization, open the airway, check for a pulse, or measure the body core temperature. You just realize that they're unresponsive. The answer was provide manual inline stabilization, and I'm like, he's
Really?
drunk. Like, yeah, that's the answer that they give in the book. I thought it was open the airway.
Me too. I would have said that right away.
Exactly. But it says A. I think it's B.
Well,
Anyway.
Kim, did you do the test yet?
No.
No.
I'm doing it tomorrow.
You
Yeah.
need 3 hours.
Mm. Well, she could be smarter than me and not need 3 hours.
Yeah, I
I'm
needed
gonna
3
need
hours.
3 hours.
I needed 2 hours and 50. I needed 2 hours 49 minutes because I finished and I had 11 minutes left, and then I went through and I looked at all the ones I flagged.
Yeah, and it's funny because the ones I got wrong were ones I didn't flag.
Oh, really?
Like, whatever. But I used my book, like without question, book and Google. Like if I didn't have those, I would have flunked. No question.
There's so many. There was so many like. We're not giving you the answers, Kim, but there was so
No.
many
And
like.
I don't mind.
There was so many like cardiac ones, and
That's
Yeah,
what
there's
I
a
like.
lot.
The like, this is the patient, this is what they have,
yeah,
these are the symptoms. What do you think it is? And then what's your first line of treatment? And it's like some of them I just was like, I don't know.
don't you feel like there was more cardiac than anything else on that
Yeah.
on that test? There was so much.
There was a lot. There
Respiratory
was some
too.
anaphylaxis. There was
For me,
there was a
those.
lot of-
I can't believe we already have a test next Tuesday. We have another
know.
quiz. We have another exam opening up. You know why though? It seems so short because this one actually opened up last Friday, and it
Yeah.
should have closed last Friday, but he let it go for a week.
Right.
So, but that
Which
just
I'm
means that
grateful
we're so
for
much
because
closer to the end.
I don't know how I would have managed to get it done between working, being sick,
I know.
clinicals. Like, I'm like, I don't know when I would have done it if I had to do it in one day, like before.
I set time aside, but I had to prep the area for the heaters that we just put in, and these past 4 or 5 days, I've been so stressed out. Like I was unhooking my water tank, draining it last night at 8 o'clock
Oh my God.
because I had to get it all ready for today, for this morning. They got here at 7.
Yeah, I came home from work on Monday. My husband was working. I'm like, I'm going to do the test right now.
Yeah, good,
And I just
good.
had 3 hours of uninterrupted, but I needed all 3 hours. And had I not been able to use the book, I would not have passed. No way.
You
I
have
think-
more confidence in yourself.
Yeah, I think I'm gonna do more of those tests like we just did tonight. I think that's the key. Fred was saying that, I thought earlier in the class. He was saying that the tests helped him out a lot. I thought
Ugh.
because you know what, they use the same dang questions. So
Yeah.
if you go over all the questions, you may have seen the right answer once upon a time.
I
Maybe.
guess. I had a friend that is an EMT now. She told me to use the website. It's called emtprep.org. She said she used it and there's an app, I guess.
Yeah.
So
But me,
she said it really helped her get through her EMT class or prepare her for the tests.
I wonder if that's the same one that one of my friends told me to look into.
I don't know. I wrote it down. I got it.
All right, you guys ready for the environmental?
Yes,
I am ready.
definitely. And if you could bang this out quick, that'd be really cool.
No pressure,
no
Morgan.
rush. No rush. I'm just kidding.
Quality. I'll give my
No
quality shot. So we're gonna be talking
isn't
about
easy.
environmental emergencies. No.
Easy topic.
Blah blah. I don't really care about medical emergency. Can result from environmental factors. Of course, especially in rural areas or in cities as well, because of homeless population. Children are more susceptible and older because children have a higher ratio of surface area to mass, and older people just can't compensate as well. And people with chronic illnesses, there you go. And over young adults who think themselves invisible are susceptible. So some of the things we're going to talk about is hot and cold, water emergencies, pressure-related emergencies, injuries caused by lightning, and venom.
Have you ever
snakes.
taken care of someone that's been hit by lightning?
No, I have
No.
not.
I'm just curious. They say it happens more than people think it does. I just curious.
Apparently it does. My son was talking about it this afternoon, how his teacher's mother got hit by, I'm going to double check with this because I can figure this out, got hit by lightning. But and then Devin was saying how her grandmother, she said she got struck by lightning, but I think it was more of a, it definitely wasn't a direct hit. She was doing the dishes when lightning struck, and she got a jolt from that.
Oh yeah, yeah.
I know only one person, and they got it actually through they were talking on their cell phone in a storm in their car.
Oh, so that's a myth with the rubber tires.
Apparently, the lightning hit the car, traveled through something into the cell phone into his hand. I don't know. I mean, he was in the hospital for like 2 days, so.
I believe it. I'm just saying that.
Yeah,
sucks.
I just was like, I was like, I think you make this up. He's like, no, this is what
I know
happened.
there's so many like myths like right there that yeah.
I always thought you were safe in your car.
No, I knew, but I never really cared. I was like, if it's once in a, hey, you can get a tumor more than getting hit by lightning.
Exactly.
Apparently.
Right? Facts.
So physical condition. So this is going to be factors affecting like the good outcome or mortality of the patient. Physical conditioning will obviously like have effect. I'm not in very good shape, but I do have a lot of insulation for the outside cold and a lot of calories to burn. But like if I was in a heat, an area was really hot, I probably wouldn't last very long. So like again, we were talking about earlier, right? If it's in children, they have higher body area to their mass, like so they let off more heat or more susceptible to heat-related injuries and dehydration than like adults and teenagers. But like older adults cannot compensate as easy as younger people. They're not designed for it, and so that they are very susceptible. Somebody who's hydrated and well nutrition will be better. Like hydration, like if they're in a heated area or a hot area, you can like secrete sweat and your electrolytes will be staying balanced longer. So and nutrition, like if you're gonna want it, you're gonna be burning calories to keep yourself warm, or with shivering or whatever and sweating for cool off. So like when I was listening to you talk about that question with alcohol, which was it seems interesting. So it's like alcohol makes it feel like you're warmer, but it really doesn't. It actually makes it harder for your body to regulate temperature, even though people feel like they're warm. What you're reading is like talking about almost sounds like suicide. Just somebody just wandering off and drinking alcohol in cold temperatures.
Yeah, not smart.
So factors also exposure, environmental conditions like the air temperature, obviously. Like during the day today was pretty crisp. Like I could go out with a t-shirt or whatever, but if I went out like I'm dressed right now, I would not last very long. It's probably like 30 or 40 degrees. So I'd probably get cold quick. And the humidity level, especially in the summer, like it's a huge factor. Like it makes it feel like a lot hotter than what it is. In the wind, like how depending on the speed of the wind, if it's like cold, the wind will make it feel like it's colder. Extreme temperatures and humidity are not needed to produce injuries. Nope. Any questions about that factors?
No.
No, pretty straightforward.
Yep.
So cold exposures. So what happens with the body? Like the body wants to have homeostasis all the time. And anything that disrupts it is not gonna bode well. So it will do things to itself. to keep homeostasis, and like it'll keep the vitals organs as long as possible. So like your hands and feet, it will like shunt. If you're in cold, the body will start shunting the blood into your core of your body to keep yourself warmer and to keep the blood warm. And there's 5 ways that the body can lose heat. Let's find out who read the chapter or not. What is the 5 ways body can like lose heat or gain
Convection.
heat?
Convection.
Convection is one of them. Which is what?
I didn't get
Convection.
What does convection mean?
Conductions. Convection is when you're near. No, that's radiation. Radiation is when you're near like the sun. I'll do that one.
Right. So yeah,
All
like radiation.
Convection.
So just like off-putting, like I'm radiating heat right now.
Yeah. Convection's air, like wind.
So what I always kind of think of appliances when like I would read this chapter or whatever for heat related injuries. Convection, ever heard of a convection stove?
It has wind in
Yeah.
it. Yeah, it moves air.
Yeah, it kind of blows air around whatever
Yeah.
you're baking, and it's
Good
supposed to make it
call.
bake faster.
Yeah.
So our microwave creates radiation to
Yep.
warm stuff up because it kind of gets the cells all like excited or whatever. But so what like fire is like is
It's
radiation,
radiation.
kind of like you're
Yeah.
standing next to it, but it's hot. Convection radiation, conduction. So like the little lady who falls on the floor, even though it's 70 degrees in her house and she's 98 degrees, just her laying on the floor, that's a lot of surface area that's competing for
cold
like
floor.
70 degrees or colder. And so they can become hypothermic. Just so conduction is like touching. So like as we're talking about electricity, like metals, it conducts electricity. Like metal is also a good conductor of heat. Glass does not conduct heat or electricity. So this is another way to think about it. Conduction, convection, radiation.
There's
What are the other
evaporation.
ones?
Right? Evaporation.
Evaporation's another one. Yep. So like when we sweat and it kind of dissipates as where it evaporates, it dissipates the heat. And respiration, that was the last one. So when we breathe in and out, we're breathing in out like we're breathing in the air that we take in or whatever. So my house is like 70 degrees. I'm breathing in 70 degrees, but I'm also going to breathe out 98 degrees at the same time, especially the moisture. Like respiration can create. So another story about my wife. She got when we first met. She got like nobody really know what happened, but she got some type of pneumonia, and she coughed a lot or whatever, and was not drinking enough at the same time, so she became hypovolemic, right? Shock.
Yep.
But also her body temperature lowered because of like just like respiration can do a lot of damage if you don't keep homeostasis. So like you're also like breathing out warm air or breathing in cold air. Like when we were out on a cold day, that fog that just leaves us, you can see it.
Yep.
Any questions on the 5 ways? Nope. Okay.
I don't think so.
So the rate and amount of heat loss is gained or decreased is modified by 3 ways. So we can increase or decrease heat production. How does our body do that?
Shivers.
Shivering.
Shivering. What does shivering do to our body?
Moves the muscles.
It
Okay.
increases the temperature. It's what it's trying to do.
It does. You're right. But on a cellular
Metabolism.
level, what's happening? Yep. We're increasing our metabolism. We're making our cells work. So what else? Oh, they're right there. We can go into a warmer area if we're cold, or
Oh, sweat.
go to a cold. What's that?
Sweating. Sweating is the opposite of kind of shivering. It's your body's dealing with heat, but that's later on. Sorry.
No, you're right. No,
That's
don't be sorry at all.
increasing
Yeah,
and
yep.
decreasing. Yep.
So sweating will decrease our heat, hopefully,
Yes.
by evaporation. So we can also like move into a hotter area or cooler area or whatever we need to keep homeostasis. So something that we do, apparently I'm not north yet until you're in Maine, north. Even though I'm on the border of Canada.
Yeah.
We do it very well. We dress in layers, especially in this like fall, winter, because it'd be like 40 degrees, go up to 60, 70 degrees, and go back down to 30. So like we dress in layers. And if it's winter out, we're definitely gonna dress for the weather, cold, or whatever. So how do we, moving on to hypothermia, how do we determine if a patient's hypothermic, or is it in here? We're going back.
Like what temperature?
Yeah, how do we gain their temperature? How do we know? What do we do? Do we just like put our hand on their head and like, oh, they're really cold?
Take their temperature.
I mean, outside of physically taking their temperature? Is that what you're asking?
Nope, it's physically taking their temperature, but where?
Their butt.
Yep, rectal. We're gonna need a core body temperature. Not that I've ever done it in my career.
That's for the hospital.
Yeah, I am never telling a nurse that whole.
His
I worked
core
in a hospital for
temperature
10 years.
is
I
89.
totally understand what that comment means. Hey, I'm just saying.
So yeah, if we have any indication, like if the person's like hyperthermic or hypothermic, we're supposed to be taking our core body temperatures through an orifice. Anything below 95 degrees, the book says that the body's unable to regulate its own body heat. That's when it's internal, and stuff starts to die, like necrosis, and organs start to slow down and shut down. Yep. There is a story though that I read. Somebody climbed in a landing gear of an airplane, and they're not pressurized or whatever, or heated. So he was like hypothermic, but when he landed, he was still alive because he went to a hypothermic state real quick. He lived. Air temperature does not have to be below freezing to occur for hypothermia. Like it's not freezing right now where I am, but it's cold. And if I walked out in shorts and t-shirts, I would become hypothermic. And depending like on how cold it is, like it could happen gradually or rather quickly. And I've seen this before. Homeless people who can't have no place to go at night, especially when it's they can get hypothermic. And I've seen like somebody who in the dead of winter could not heat his house, so he's trying to heat it with a stove, and he died of hypothermia, we think. And he had a dog, and I can't remember last time somebody saw him, but it was really kind of late. It's sad. So swimmers, because of course they're in water that's cold. Like my daughter, we live right next to a lake, and she goes swimming all the time, and she'll go when it's freezing. To me, but that's again like teenagers who are courageous. But like the water's like 40 degrees, she'll come up and her lips are blue and her fingertips are blue.
We stay longer, Dad. And her lips
Yeah,
twitching.
I don't know how she does it. What's that?
My kids used to do that. Can we stay longer? And their lips are blue and they're
Right.
shaking and they want to stay longer.
Crazy. So geriatric patients again, because they cannot maintain or compensate very well. Pediatric patients, because they can't compensate, and their bodies are just disproportionate. And like people who have chronic diseases are more susceptible. So signs and symptoms become more severe as core temperature falls. And here is, so anything below 80 degrees Fahrenheit is death. Like we don't even, so anything, this kind of like chart talks about like the signs and symptoms with the varying degrees. So like the shivering, and they're gonna stamp their feet. I guess that just creates more heat and more movement. So this is when the body is going to start constricted blood vessels and rapid breathing to move blood around. And they've become actually altered. I've seen people altered with this, but again, their blood vessels going to start constricting, bringing that blood into the core to keep their core warmer. Then the opposite happens when people are hot, like the body will dilate and get the vessels open, especially in the head, to get rid of some heat that way. So below that, 92 degrees to 89 degrees, there's going to be like loss of motor function, muscle stiffness. Stuff's going to start slowing down, slow respiration, slow pulse. Like the blood's going to be like syrupy, like going to be almost frozen. And if you've felt anybody that's like really cool, it's like it's weird. They're going to become more confused and lethargic, just like with it. After between below 86 degrees, they're going to be comatose, weak pulses, dysrhythmia, and I think this is when the patient or whatever will like. That's when you need to check for a pulse for a minute, and they're going to become unresponsive. And I've seen videos. I think this New Hampshire State has a video of emergency, like heat stroke and hypothermia, and they say like people, if they're outside, will go and hug a tree right before they die, and nobody really knows why.
That's weird.
Yeah. So, like, I guess he's just gaining a general temperature, like place it on the back of the, like on the abdomen. I would do the forehead, but abdomen works too. I guess it's more of a core. So again, this is going to talk about the different states of hypothermia. So this is like when you're just outside and it's cold and you're not just dressed appropriately. You're shivering. You could be pale, like windburn, cyanotic because your vascular system's pulling the blood back into your core. Increased pulse rate and respiration rate. And then again, it's just gonna from 86 to 93.2 degrees Fahrenheit. So shivering stops, motor function stops, and they start to become altered. Below 86 degrees Fahrenheit becomes lethargic and stops fighting, end up dying. How do we treat patients with hypothermia?
Warm them up
How?
gently.
What's that?
Gently.
Very gently. Very, very gently. Yep. Like strip their clothes off, like crank the heat in the ambulance. With my old agency, like I used to volunteer for an agency, and when I went through, they were talking about a guy who got skin to skin with somebody and like got underneath blankets, but the patient lived. So there's like injuries, like if I never wear a hat, even though I should, obviously. Um, I could like end up with local injuries. So that's like with injuries right to the hands or to the face, nose, like, and it could be like frost nip, trench foot, frostbite, like stuff that starts freezing off. So the frostbite, see the blistering?
Mm.
It's gross.
You've seen it?
No,
Oh, you haven't.
I've almost had it, but I've never seen it. And that's when you can, well, they say not to put it like in hot water, warm water. Like let the ER do that. So
Yeah, I think
determine.
it talks about in the. I think it talks about in the book. Correct me if I'm wrong. Anybody else that did the reading just recently, but I think it said, just transport, don't rewarm is probably the best bet.
Right.
Let them.
Yes, it should be. Like, but for severe cold, like you can put warm packs on their trunks. I don't know if the book talks about it here. I do it. Like on the neck, put warm packs, like under the armpit in the groin area.
Groin. Yeah.
But if you can like re-put somebody in hypothermia, because if even though you're warming up those spots, it's gonna get circulated into the heart, and then it takes a long time to warm somebody back up. So factors that include like the local exposures, like anything else, how cold the temperatures were, like windy, was it humid, the duration, um, and what body part was exposed and for how long. Like your hands and feet don't last long out in that stuff. So what we talked about in the beginning of the slides, exposure, like considering underlying exposure to wet conditions, inadequate insulation from the cold or the wind, restricted circulation from tight clothing or circular disease, fatigue, and poor nutrition. Alcohol or drug use, because alcohol does not warm, even though people think it does. And it just gives a sense of this false sense of euphoria on both of them. Hypothermia, diabetes, cardiovascular disease, and age. So frostnip is kind of like redness. It might have some swelling. Uh, so usually it's like the affects the nose, ears, and fingers. Um, but if like prolonged frostnip will get frostbite. Immersion foot or trench foot occurs in prolonged exposure to cold water, common in hikers and hunters. So like people's feet who sweat but then get cold will also have this problem. Did we'll go back to that? Hold on. I don't think. Oh, it's not this picture. Never mind. So after prolonged cold water, so pale, cool skin around that area, like, and if you touch it or whatever, like if you touch it right now, it'd get white, but once you let go, it returned to like a red color. But after you did palpation, like it wouldn't return. It would just stay like kind of weird. The skin of the foot may be wrinkled and loss of sensation and feeling. Also, this is severe frostbite on this patient.
Oh boy.
Wow.
And so, yeah. So they call this like gangrene or necrosis. So this patient will probably lose all of these fingers. Yeah, it's like they're kind of rotting off. He has no sense. He can't feel those. Um, yeah, right there. Gangrene requires surgical removal. and there's nothing we can do about it.
Nope.
So it's almost like a burn, like hard waxy feeling, and they don't feel it, but like there also could be blistering, like second degree burns have blistering. It's kind of the same thing with frostbite. The depth of the skin is damaged will vary. Superficial frostbite is only on the skin. Deep frostbites, deeper tissue. And we're not going to be able to tell the difference. So I don't know why they don't have it, but they had a picture of the somebody's hands like were all messed up, and there was a ring on one of them. And I don't know if they say it, but that stuff should actually come off for anything like dealing with hands.
Remove all jewelry. Yep.
Okay.
Same with burns. Yeah.
Yep.
Burns and
Because
hypothermia,
it's going to cause swelling, and you
I
don't
mean,
want
not hypothermia. Yeah. Frostbite.
So no scene safety, note the environmental conditions. Ensure scene safety for you and your responders and crews. Identify. Oh, we have icy roads, mud, and wet grass. Use appropriate precautions. Like if it's cold out, and I'm really, really bad about this. Like I hate wearing like thick jackets when I'm on duty, especially going to calls. So I'm usually not dressed for the weather. So that could become an issue for me someday, and it hasn't yet, per se.
Yeah, when you're out in a car accident or something, probably I could see it.
Yeah.
Or a fire or something. Yeah.
So consider the number of patients as quickly as possible. Like if there's whatever, summon additional help like ALS, or if there's more than one patient, more than one cruise, or a DART, whatever you need. So if the patient's sick or not sick, or the mechanism of injury or nature of illness. So we're environmental. So we're just looking. I mean, if there's skiing accidents, they become hyperthermic. They could be having environmental emergency as well. So again, we're going to form our general impression. Sick or not sick. Treat any, do our ABCs. We're going to check the core temperature using a regular thermometer in the forehead. No, in reality, we should check core temperatures. Evaluate mental status using the APU scale. And people who aren't alert, especially to painful, they're really sick. And I responded to somebody who was diabetic. We discovered he was hypoglycemic, so we gave him like the meds to bring his sugar back up. But he was still altered. He never, like, usually somebody who's diabetic